morning, and welcome to the 2020 Temple Fox School of Business Wells Fargo Data Science Conference. I'm John Leone, Head of Quantitative Strategy here at Wells Fargo. On behalf of Wells Fargo and our partners from Temple, it is our privilege to host you for today's event. Wells Fargo is dedicated to fostering cooperation between the academic and professional communities. Advancing collaborative opportunities for academic practitioner research and idea sharing are priorities for us here at Wells Fargo, and today's Data Science Conference speaks to that dedication. To that effect, we are delighted to partner with Temple Fox School of Business to provide this collaborative learning opportunity. Dean Ron Anderson, Ed Elding, and their Temple teammates have been remarkable partners in organizing this event, and it's been a pleasure for our Wells Fargo team to work with them. This morning, we're fortunate to have a distinguished roster of faculty representing an elite set of universities. We at Wells Fargo and Temple University are honored by their presence. Today's format may be a bit unique, and our panels are essentially presentations. Each of today's academic faculty will present a topic with some utilizing supporting materials and equations. So throughout today's conference, you'll see some boxes popping up and whatnot. And again, this should be a very thorough review of their content, and we have done everything we possibly can to make sure that the supporting materials will help guide that. And to that effect, also included for today's event are papers specific to each professor's research, and these papers are listed in the library section of the event website. This site can be accessed throughout the conference, and we'd encourage you to do that. And again, even after the conference is over, we'll make sure that the website stays up and this academic research is available to you all because it's so outstanding. And at the end of each presentation, there'll be a 30-minute question and answer session, and we encourage you to submit any questions you may have. And to submit questions, we have an email address set up for that, which is listed on the event website, and will also be popping up throughout the presentations. Now, at this time, it's my pleasure to introduce Ron Anderson. Ron is the Dean of the Fox School of Business at Temple University. Under Ron's leadership, the Fox School of Business has thrived with a particular focus on advancing academic corporate collaborations, most notably through Fox's Translational Research Center and Fox's Data Science Center. Ron and his faculty have been exceptional partners, and it's my privilege to introduce him at this time. Ron, thank you for your partnership, and I'll turn it over to you, sir.
Thank you, John, and thank you everyone for joining us today. As Dean of the Fox School, I think that today's event sits at the core of what we like to do: bring together practitioners, researchers, and thought leaders with the goal of driving business forward, growing connections between academia and industry, and building a collaborative world in which our students can thrive. In the nearly 2.5 years since I became Dean of the Fox School, we continue to prioritize research as one of our key outputs, as outlined in our 5-year strategic plan. We envision the Fox School as a place for innovative education and as a change maker for its community, with impactful research that drives business decisions. We want to take that research beyond the academic world and impact the way managers think about their businesses and the ways they conduct business. That requires translating research into impactful ideas that serve the business community. And that requires partnerships with industry leaders like Wells Fargo. Wells Fargo is our partner in sponsoring today's virtual conference, but they are also our partner in funding a new data science-based research initiative. There are several major trends happening across the business world right now: the infusion of data science, the development of AI and machine learning, and the need for professionals who can analyze data and make decisions with emotional intelligence. Big data sets, machine learning, and artificial intelligence are all making business much more efficient, much more competitive, and tomorrow's professionals need to be fluent in the role data plays in problem solving and innovation. Through our data science program, we provide learning opportunities that empower our students to become problem solvers through the use of data. We want them to understand the changes taking place in the marketplace, but we also want to position them to be active, to make decisions that move industries and communities forward. Every year, new and emerging markets, technologies, and political realities continue to drive global commerce. This year, as we all know, has brought new and unprecedented challenges to the global marketplace. Which brings me to today's event. We believe that research is the conduit to making a fundamental impact on business education and the business world. That is reflected in our strategic plan and motivates us to be together today. I am very proud of our data science program at the Fox School, and I am proud that we host this conference and others that connect our educators with practitioners. That partnership between educators and practitioners drives developments in our curriculum, directs research to closely align with practical needs, and helps our students become leaders in the business world. Again, I want to thank you for being here. I want to thank Wells Fargo for their partnership. And finally, enjoy yourselves today, and thank you.
Good morning and welcome to session one of our data sciences conference with Temple University. And our first session this morning is very topical given the times in which we live. Our first session is leveraging COVID-19 data for quantitative investing. And monitoring and hosting all of today's sessions for that matter is going to be Edo Arioldi from Temple University, where he is the professor of statistics and director of the Fox Data Science Center, excuse me, Edo. Also joining us this morning from Yale University is Nicholas Christakis. And Nicholas at Yale is a Sterling professor and co-director of the Yale Network Science Institute. We are also very fortunate this morning to have David Madigan. David comes to us from Northeastern University, where he's provost and a professor of statistics. And also joining us, we are very fortunate to have Ben Yu. Ben comes to us from the University of California, Berkeley. Ben is a professor of statistics and a Chancellor's Distinguished Professor. We thank you all for participating this morning, and we're excited to have you. So, Ed, I'll turn to you, sir.
Thank you, John. I also want to chime in and welcome our distinguished faculty guests on behalf of the Department of Statistical Science here at Temple University. So thank you all for being here. As John mentioned, today's panel, first session is about COVID and COVID data and meta-analysis involving complex data sources. So the first speaker is going to be Nicholas Christakis. Nicholas is an expert of COVID. Back in April, he published one of the first papers tracking the epidemic in China on a journal called Nature. And he has recently published a book titled Apollo's Arrow that's been translated in 5 languages and counting on COVID. So Nicholas, welcome and thank you for being here. I'm going to turn it over to you.
Thank you very much for having me, and thank you to my fellow panelists. I'd like to spend the time that I have with you talking a little bit about some basic epidemiology about this pathogen and summarizing some of the work we've been doing using a variety of data and statistical techniques, and then close with a little bit about what I think is likely to happen in the coming 4 years as this pandemic continues to afflict us. So something very unusual has happened to us as a species. We happen to be alive at a moment when a new worldwide pathogen has been introduced into our midst. This doesn't happen very often, maybe every 50 or 100 years. And this new virus, this SARS-CoV-2, is going to be with us forever from now on, circulating among us. And in fact, the way we have come to live in this time, in our time in the pandemic, may feel, it probably surely does feel, very alien and unnatural to us. But it is actually neither of those things. Plagues have always been a part of the human experience. What's happening to us right now is not new to our species. It's just new to us. We think this is so unusual, so weird, so intolerable in a way, but actually our ancestors have been dealing with plagues for hundreds or even thousands of years. And by this time in the course of the epidemic, 9 or 10 months into the pandemic, we know quite a bit about this pathogen. We know, for example, how lethal is the pathogen. A recent sophisticated meta-analysis of many studies has revealed that the infection fatality rate of this pathogen is between 0.5 and 0.8%. And actually, if you develop symptoms of the pathogen, because only about half the people develop symptoms, you have to double those numbers to about 1 to 1.6%. Let's say that about 1% of people who get this disease and get symptoms from it die. That's a non-trivial infection. It's not as bad, of course, as smallpox or cholera or bubonic plague, but it's still not trivial. Furthermore, at this point, we also know, and the mortality depends very sensitively on age, as most people know. So that, for example, if you're in your 20s or younger, you might have a 1 in 3,000 to 1 in 5,000 chance of dying of the condition if you get it. If you're middle-aged, maybe a 1% chance. If you're 75 or 80 or older, maybe a 20 or 25% chance of dying if you get symptomatic COVID. We also know some other things about the pathogen. We know how infectious it is. This is known, as everyone knows now, by the so-called R naught, the R sub zero, the basic reproduction number. That's a measure of the innate capacity of the pathogen to cause new infections in a wholly naturally interacting host that is non-immune. So when the epidemic first starts, what is the intrinsic capacity of the pathogen to infect more people? This number is between 2.5 and 3.5 for this pathogen, probably between 2.6 and 3, let's say 3. So 1% case fatality rate, basic reproduction number of about 3. But this pathogen has some other sneaky qualities we've now also been able to ascertain. One of them is its ability to cause super spreading events. And this can be measured by something known as the dispersion parameter, or kappa, and was beautifully discussed in a paper by Lloyd Smith in 2005 in the journal Nature. And so to get a feel for this, I'd like you to think about the following alternatives. Imagine you have 100 people in a population, and each of them, if infected with SARS-CoV-2, could infect 3 new people. So the R naught would be 3 in that population, but everyone has the same R naught. Now imagine another population of 100 people. 99 of them can infect no one, and 1 of them can infect 300 people. They're like a super spreader. Again, the R naught in that population would be 3. Now, you should have the intuition that in this type of a situation, if a person from the first population migrates and goes to a new location, it will inexorably set into action of the epidemic. They will infect 3 people, and those people will reliably infect 3 people, and so forth and so on, and the epidemic will continue. But so there you have a very small dispersion. Everyone has the same R naught. But in the latter population, you have a high dispersion, and there, if one person moves from this population of 100 somewhere else, 99 out of 100 times, the epidemic will dead end and will not continue. And this is, in fact, one of the qualities of this pathogen. It has this variation in the R naught across people. Many transmission chains are dead ends, but we also have frequent super spreading events. And this has implications for how we manage the condition and for how we discern what's happening. And finally, in terms of the introductory epidemiology, but I could keep going, but I'll just mention one more feature. This pathogen has a very annoying property of affording the opportunity for asymptomatic transmission. That is, the infectious period in an individual, the moment when they are able to transmit the disease, often arises before they themselves have symptoms. Now, this is not always the case. For example, if you think about the disease smallpox, people with smallpox cannot transmit the disease until they develop pustules on their body. So we can use their symptoms to discern who is infected. Conversely, if you think about HIV, people with HIV can be completely unaware that they have the virus and spread it for years before they get symptomatic. SARS-CoV-2 is like HIV. You can spread it before you have symptoms. And this makes it very difficult to manage. In fact, many studies now suggest that up to 75% of cases of SARS-CoV-2 arise from asymptomatic transmission. And before continuing, I want to say one other thing about this pathogen, because it's just dumb luck to us that the pathogen is not worse. There's no God-given or intrinsic reason that this pathogen couldn't be infecting killing 10% of the people who get it, or 30% of the people who get it. We could, in fact, have been facing a worldwide bubonic plague type situation. And many experts have been fearing these types of respiratory pandemics for a long time, and fearing that they would be even worse than what we're facing. So bad as COVID-19 is, I want people to realize it could have been worse. The disease could have been more fatal or more transmissible, or both. And we're just lucky that it is not. Now, as Ido said, my own work in this began in January, and I'll just summarize a few big data projects we're doing because they provide some insights into how you could use data techniques to track and forecast the course of the epidemic. One of the first things we did was, beginning in January, I had some Chinese collaborators that I've been working with for a long time, and we'd been using anonymized Chinese phone data to study a number of social phenomena. For example, when there's an earthquake, how does an earthquake reshape human social interactions? Or if you build a high-speed rail line, how does a high-speed rail line change interactions and therefore prompt economic development? And we were using phone data over large spans of time to study these phenomena. And in January, I was speaking to my colleagues in Hong Kong at the Chinese University of Hong Kong and at Hong Kong University, and some other colleagues from mainland Chinese universities. And we decided that we could use these data to track the course of the epidemic in China. And what we had is we had phone data regarding the physical transits of human beings through Wuhan, which for hundreds of years has been a central transportation hub in China, as luck would have it. We were unlucky that the virus leapt to the human beings in a very large city that also happened to be a transportation hub. And it would be like, well, anyway, I was going to compare Wuhan is like New York City versus the virus, let's say, taking root in Bismarck, in the Dakotas, for example. So it was bad luck for us that it started there. And we had information on 11 million transits through Wuhan up until January the 24th. And we could see these people spread out across the country. And just using the phone data alone, just using information about the movement of human beings, we were able to predict the timing, intensity, and location of the epidemic up through the end of February in China. And we developed a model that allowed this forecasting, which we call the risk source forecasting model. And it can allow you, using human mobility data, to predict the course of an epidemic. But while I was working with my Chinese colleagues doing this, and that was the paper that Ido mentioned that we submitted February the 18th, it was actually quite an exciting moment for me in my career because I hadn't pulled all-nighters since I was in graduate school, but with my collaborators on the other side of the world, we were working 24 hours a day for 3 weeks to get this manuscript completed. But because I was so intimate by then, so aware of what was happening in China, by the end of January, on January the 24th, the Chinese were so concerned by the virus. After initially covering it up and doing a bunch of stupid things, they began to take it very seriously. And they were so concerned about it that they essentially detonated a social nuclear weapon. The Chinese put 930 million people under some form of home confinement, beginning January the 24th through the end of March and into April, which was astonishing. And this really got my attention. And as I was sitting at my desk at the end of January, I could think of no reason why the same thing wouldn't happen to us. There was absolutely no reason the virus would not come to us. And every epidemiological expert I was in contact with at the end of January felt the same way. So I became very concerned, and I began to direct my lab to begin to look at some of these topics. And we began to do a whole bunch of things. One thing we began to do was to look at the, because by the springtime, we had the primaries, the political primaries were taking place. And I was very concerned that turnout to voting, the assembly of people in polling stations, would contribute to the pandemic. And in partnership with Eric Feltham, one of the statistics grad students in my laboratory, we did an analysis of whether turnout to vote on particular days in particular locations throughout the country in the United States affected the trajectory of the pandemic in those counties at the county level. And to my surprise, we found the answer was no. So when we started the project, I had thought that voting, turning out to vote, was a kind of mass gathering, and that surely could not be a good thing. Although back in the spring, the prevalence of the pathogen was still relatively low in our country. But it turned out that that was not the case. And I think part of the reason was that if you actually think about voting, and since then we've now learned a lot more about the virus and its transmission, people line up outside, for example, before they go inside. When they're inside, they're there for a very brief period. Voting is a private event. You're not face-to-face with other people. You're in a little cubicle. It's quiet. People aren't raising their voices or shouting, as we now know is a mode of transmission. And it's brief. You're inside only for a brief period. So that's another project that we did that we've now posted online. And if you're interested, you can look at. My laboratory also began to work with some of the software engineers in the lab to prepare an app, which we call Hunala, H-U-N-A-L-A, Hunala, H-U-N-A-L-A. This app is available on the Apple Store and on Google Play. It has thousands of users. It is like Waze for coronavirus. This is not a contact tracing app. It's not a backward-looking app. nor is it a citizen science app, which just has people report their symptoms for use by public health authorities. It's an app that users can actually use to forecast their risk of getting the virus by kind of like Waze. In other words, Waze, people are driving down the highway, you're driving down the highway and there's no police stop and there's no traffic jam where you are, but 3 or 4 miles down, people have reported that traffic is at a standstill. You can be notified about this, and then if you wish, you can exit the highway and avoid the traffic jam. That's sort of what our app does. It crowdsources information about the location of the virus, and based on where you are in social networks and where you live, it feeds back to you risk models and estimates of your probability of becoming infected with a virus in the near future. The app, at the beginning, it asks for to access your contact list, but we do not copy your contact list, and the app, if you allow it, accesses your contact list just to make it easier for you to signal who you interact with. It does not copy. There's no privacy consideration of that kind. And we began a number of other projects in the lab. As Ido mentioned, I decided to work on this book. And part of the reason for that was back in February and March, I was very concerned that our leaders in this country, beginning at the White House, were trivializing this epidemic. We're not taking it seriously. And I thought that there was a significant need for people to understand what was happening to us epidemiologically and historically, and that led to that other effort. Let me just say a few things more about the what I think is likely to happen in the coming years, and then I'll close with sort of one big idea. It's actually not such a big idea. It's just an idea. So earlier we talked about the R naught, and that for this pathogen it's about 3, and this property, the infectiousness of the property, is mathematically related to what is known as the herd immunity threshold. Herd immunity, as many listeners have probably been thinking about, is the ability of a population of people to be immune to a disease, even if not every individual is personally immune. So imagine, for example, you vaccinate 96% of people in a population for measles, and one of the 4% unvaccinated people gets a case of measles somehow. That person would be very unlikely to be able to start an epidemic because almost everyone they interact with is immune. So you don't have to vaccinate 100% of the people. Just vaccinating 96% of the people is enough to make the whole group of people immune. Well, you should have the intuition that the fraction that you need to vaccinate or that need to acquire immunity naturally is connected to how infectious the disease is. Measles is the most infectious disease known, so the herd immunity threshold is super high. Most of you know that for seasonal flu, nowhere near half or all of Americans get vaccinated every year. In fact, about 30% of Americans is enough. And that's because the R naught for measles, the basic for the flu, for seasonal flu, the basic reproduction number is about 1.5. So to calculate the herd immunity threshold, you use the formula R naught minus 1 divided by R naught. So if you plug in the number 3, which is the basic reproduction number, the R naught for coronavirus, for COVID, you get 3 minus 1 divided by 3, that's 66%. So the herd immunity threshold using the standard formula for this virus would be 66%. Now it turns out that that calculation makes some assumptions, something known as the well-mixed assumption. It assumes that everyone in the population has an equal probability of interacting with or becoming infected by everyone else. That is not true of real-world populations. And network science insights, including a whole bunch of ideas that Ido Aroldi has innovated in, suggest that that number needs to come down. So, in fact, the herd immunity threshold in the United States is probably 40 to 50%. Let's say 45% of people need to be immune in order for us to have herd immunity and reach that threshold. Well, right now, only about 12% of people in the United States have naturally acquired the disease. So we're still at the opening act of this pandemic. We've got a long way to go. We're not at the beginning of the end. We're just at the end of the beginning of this pandemic. And absent a vaccine, which I'll come back to in a moment, this would be the natural course of the virus. It would just spread and spread and spread until it reached the herd immunity threshold. Then the epidemic force of the virus would decline. The virus would still be around, but we wouldn't have this sort of escalating epidemic any longer. So what do I think is going to happen? As we've all seen in the news, vaccines are already in late phase 3 trials, which is just miraculous. Unlike our ancestors for hundreds of years who had no access to any effective treatments, we happen to live at a time when our time in the crucible of this plague, is when we actually can invent effective preventative measures like vaccines. So we've seen 2 so-called RNA vaccine trials release their results, and more vaccines no doubt will be released. Most of them will begin, or these trials will begin to be documented, these vaccines as effective, let's say in the first quarter of 2021. But inventing a vaccine and getting its approval is just the first step. Then the vaccine millions of doses must be manufactured, must be distributed, and most importantly, must be accepted by the public. And in my estimation, this will take substantial amount of time, maybe a year. So that gets us to early 2022, by the time we have vaccinated enough people with whatever vaccines we have available. Meanwhile, the virus is still spreading. So from my desk, 2022 is a moment when either we will have reached herd immunity due to vaccination, or we will have reached herd immunity due to the natural spread of the virus. And at that point, the biological and epidemiological force of the epidemic will now be behind us. But we still need to recover from the psychological, social, and economic impact of the virus. More than 30 million Americans are out of work. Many businesses have gone out of business. People are not going to instantly return to restaurants and airports just because we've reached herd immunity. It's going to take time. People are still going to be wearing masks. There's still going to be physical distancing. And if you look at historical epidemics, that typically takes 1 to 2 years. So I think that intermediate period is going to last till 2024. And then in 2024, the post-pandemic period will begin. Now, usually during times of plague, people, now, people get more religious, for example. People get more abstemious. People stop spending money. People get risk averse. These are all things that we're observing. People get lonely. These are all things we're observing in this pandemic as well. But what will happen in 2024 is that all of those things will now start reversing. People will relentlessly seek out social interactions to nightclubs and restaurants and political rallies and sporting events and mass gatherings. People will start spending money again, I think, quite liberally. There'll be a kind of joie de vivre and risk-taking, maybe some sexual licentiousness. In fact, one person read my description of what was going to happen, one reviewer of my book, and said, here's hoping that that's what will happen in 2024. So I think that is what's likely to unfold for us between now and then. Let me just close with one final set of observations, which is not strictly statistical or forecasting, but just has to do with where I think our country is right now. I think it's very important for people to realize that during a time of epidemic disease, there is no life without risk. Everything you choose to do, everything every firm chooses to do, necessitates weighing risks against each other. Even the 14-day threshold for quarantine is actually, there's a distribution of infectiousness. It's not like by 14 days, 100% of people are no longer infectious. Actually, at 14 days, 2.5% of people are still infectious. So you're taking a risk. Even if you do a 14-day quarantine, there's some small risk that actually that person could still infect you. And you have to judge. Do I send my kids to school? Do I go out shopping? Do I have my college-age kids come home for Thanksgiving, or do I not take that risk? Every single action that we engage in necessarily involves an assessment of risk. And this, therefore, requires us in our society, in my view, to be more honest and more mature about what we're facing. Nobody wants to have to face this serious calamity. But unfortunately, this is the reality of what we live in. And what we are being called for in our country and in all countries is to sacrifice, to service, to honesty, to concern for our neighbors, and for a willingness to work together to combat this virus during our time of plague. Thank you.
Thank you very much, Nicholas, for your very informed and scientific perspective on the topic. I really appreciate it. We're lucky to have you here. I'm now gonna turn it over to Bin. So Bin Yu has recently spearheaded a tremendous effort in her lab to collect data about COVID and to create a database of of reliable information about COVID-19. She also has recently published a paper about it in the Harvard Data Science Review that is linked in the content library that goes hand in hand with this event. So Bin, I'm going to turn it over to you. Thank you for being here.
Thank you. Thank you for inviting me. And it's really a great pleasure to follow Nicholas' very inspiring talk. And next, please. Slide. Yeah. So this is really something my group jumped in March when we saw all this coverage of PPE in badly need. And we usually do machine learning, statistical genomics, neuroscience, but this is something we felt that we could help. And when there was a call from Responsible Life, a newly established nonprofit organization, we jumped in. Next, please. So most of my lab joined, and in the summer, we're actually joined by people from Google as well. Next, please. Next, please. So that's the goal. And the first task we were faced was actually curating a data repository, because this is the first project we got done that we didn't have data. And we basically used whatever available publicly and use some also connections with colleagues like Sam from Northeastern. US Facts has, and also New York Times had the county level case data. We decided to go for the case county level because most people working on the state level. Since we want to distribute the PPEs across the country, we felt like state was not fine enough granularity. So we went for the county level, and likely there were data available. We also curated a lot of data, social health, and other factors we think might be related to the death counts. We also made a choice to go for the death counts instead of case as a surrogate to predict the need for PPE for different hospitals, because cases, as we know, that depends on how many cases, or how many tests were done. And deaths, there's inaccuracies, but still a lot more reliable. And even though we don't have it at the hospital level, facility level, we have data on hospital like employee numbers, so we can kind of impute the need. Next, please. So here's a bird view of the hospital level, county level data. There are about 7,000 hospitals in the US. Each of the hospitals will have about 200 features about their locations, how many employees, how many beds, how many ICU beds, and their ratings, and the ICU occupancies. And on the right column, we also collected the COVID data, the deaths and case numbers, and also demographics, population density, age structure, as we know that age is a factor in death rate, health risk factors like heart disease, lung disease, smoking, diabetes, and also socioeconomic risk factors. So all this data is at GitHub that you can use for your own study and your understanding. We also have a website I'll introduce. Also, we start going for some mobility data, but didn't find it, all the data we had was too useful for the prediction at the county level. And so we keep collecting data. We have some KINSA data, temperatures, and some flight information between different cities. So it's a pretty extensive database we curated. And it's automatically updated for all these dynamic numbers like case numbers and death numbers. Next, please. So there are data quality issues. And as we know now, there were undercounts of deaths. Like after April 14th, a lot of counts now have proper deaths, like New York City has proper deaths. Next, please. And we decided to go for US Facts because they both, and New York Times, come from the same source, basic county level deaths and case counts, but they probably scrape the county level data at different time, do different cleaning, so they don't always agree. The reason we went for US Facts because for US Facts, the different New York City, it's not just one number. They have different counties or different districts of New York City. So that's the reason, because at the time things were really happening in New York City. We didn't want to have just one big number for the so-called city. Next, please. And here just show you that, you know, most of the time they agree, but there's some differences and they can be as large as a few hundreds. But with like 3,000 counties, it's not too big a concern. Sometimes the revisions does cause problem for our prediction, but that's just something we have to live with, unless you have really quality control at each county level. Next, please. And there's also weekday effects, right? Next, please. You can see that the number of death counts, there's definitely a daily pattern, depends on which day of the week. We think this is probably reporting delay. People probably don't work over the weekend, and therefore the death count over the weekend got reported on Tuesday, more like Monday might be too early. Next, please. So there are also historical data revisions. Next, please. And there was one case that you can see this small number near 1,000. That was a case, I think was a human error. It's King County in Washington, where I think it should be like 500. Some deaths was entered as 1,500. So later got corrected. And because the correction, you have this stripe of data revision continuously revised. Next, please. So it's imperfect data, but that's the best we can. So we want to predict 5 or 7 days first, and now can also do, you know, 14 days short-term prediction. This really dictated by the group we support, because it's enough to do 5 days for the shipment of PPEs across the country. The source of the PPE come from the local makers who use materials to make these masks. And then we work with other organizations to ship the PPEs around the country. First, we develop many different predictors. And then we also have a pretty non-parametric way, just use the past prediction errors to come up with a prediction interval. And we still maintaining a website to really visualize our data and to have our information updated, more like automatic AI system to have, I'll introduce the website later. Next, please. So that's what we set up to do. So next, after we collect data, we continue to collect the data, create the data. We have actually a data team. So with 12 people before the summer, we had different sub-teams, data team, modeling team, like a reading news team, and other people just help along the way. So it's quite an interesting team dynamic, but people work really well. Basically, many of my students drop anything, like everything else, and we work on this from March to May, nonstop for 2 months, and continued over the summer. Next, please. So do a lot of courses in the Samsung, very dynamic data. And long-term prediction have to do with feedback. I think we still, the modeling community struggling with accurate or anything. There are different teams giving very different long-term predictions. And we aimed at short-term. And we want to do it for all counties in the US instead of a particular state. Next, please. But the blessings are actually, we have always feedback, like how well we do. So it's a great reality check. We have to keep us honest. And next is that for PPE supplies, we could, 7 days is good enough. And we actually can do 14 days reasonably well. Next, please. So we had different teams of people work on the develop many different predictors. And the idea is that we kind of have parallel people working. We have separate county at the time when we started in March was exponential growth. We have exponential predictor. And then we have linear predictor, just past 5 days, fit a linear trend for each county. And then we also have shared like parameters across different counties in exponential model. And then the fourth one is we try to use some demographics and to see whether they'll improve. And then we also have the fifth one, which is just use the case and death numbers from neighboring counties and the county before, and also use the weekly effect 7 days ago, and then do the prediction. Next, please. And we have a way to combine. So this combination idea really came from 20 years ago when I was at Bell Labs. We're combining different predictions for audio compression. So this is really something you can put it under the minimum description length principle. Idea is very straightforward and simple. You just look at the last few days. You have discount factor mu in the past, like a month ago, how well you did doesn't matter too much. You just look at the past few days and you give more weight to predictors where it worked well for the last few days. And then you weigh them exponentially with the error. And then you have C control how much you want to put with the best predictor versus the others. So that's worked really well for audio signal. We fixed the mu and C from that paper because I was really worried about overfitting. And the reason why it works here is that audio signal with both lyrics and also music was very dynamic and changing all the time. This is before podcast time. At the time, we want to support the podcast over internet. And this is just signal, very signal processing or machine learning approach. Next, please. In the end, we end up using the square root because some accounts can have a long tail. We try to make things a little bit more comparable. We took a square root of the counts and use this as the error, which is all the numbers, 0.5, C was 2, and mu, I think we use 0.5. And then we can combine all the 5 predictions in a way. But it turns out 2 of them work much better. So we end up just using 2 instead of the 5. So there was this kind of screening using the data we had. Next, please. We end up using number 2 and number 5. Number 2 is just very simple, linear, use 5 days, do a linear prediction. Number 5 takes a little explanation, but intuitively, it's kind of using the loss function from a Poisson regression as a machine learning surrogate loss function. And we use yesterday's death count, and 7 days ago, the case count from the same county, and the neighbor death count 7 days ago, and neighbor county add up case numbers 7 days ago, and that's it. And we share all the parameters across different counties. And we use the weighting scheme we call CLAP now from the earlier audio compression paper, and that's what we end up using prediction up to today. Next, please. So when things are linear, we kind of put more weight on the linear predictor. When things are more exponential, we put more weight automatically. This is not humanly tuned. So here you see 3 plots. Just let's concentrate on the first plot. This is just a raw scale absolute difference between your prediction and the past, and over across different days and across different counties. This panel or plot try to show you that the combination really worked. So the red corresponds to the linear predictor, and the kind of yellowish is the exponential shared, and the blue is the combined. So most of the time works better. And the last one is the most interesting because this is using the scale square root as a measure of prediction error. That's what we use in the weight. So you can see the advantage of the blue curve is much more obvious. But it's interesting to see that for the 2 other errors, one is just absolute difference, the other is relative error, with the blue curve still turned out to be the lowest. In the beginning, you can see there's a lot of variability, and just we couldn't have much data to really do well, but eventually it's also because the total number gets big, we get a pretty good handle on the total accumulated prediction error. Next, please. This is using the same color, but the same matrix for 3 curves, but the curves mean different things. We're looking at different horizons. 7 days is the lowest, yellow 10 days, and blue 14 days. It shows that for all different 3 metrics of prediction error performance measure, it's very obvious that it's harder to do 14 days than 10 days than 7 days. And next, please. This is just to show you that if you push to 21 days, there's kind of a linear rise, right? It basically, you pay a price when you go more into the future. The way we do it is actually we do the second-day prediction, and then we use the past, pretending the second-day prediction become the real prediction, and we just keep bootstrapping up for future days. So the method works, you can keep going, but just the reliability, because the dynamic of changing dynamic of feedback loop, the method is not able to predict into the future because we don't take into account the feedback loop. But on the short-term scale, there's implicit taking into account the feedback loop, because we just see the trend of where the death count is going. So it's not a big problem without explicitly modeling the feedback loop. So I think this is more signal processing, machine learning, or statistical approach. It's a good complement to the more agent-based approaches, modeling explicitly the interactions, the networks. And for example, we could possibly combine for short run and constrain the other models, which is more involved, with this more straightforward trend following approach. Next, please. So I have talked about the predictors. We end up using 5 when we develop. We end up using 2 instead of the 5 we developed. So the next thing we wanted to do is give you a prediction interval. It's not enough just say, well, it's about 500. If you want the hospital to be like prepared, you want to give some interval so they know that really they should prepare for 500 beds, or they should prepare for just exactly 300 or 350. So we're going after interval prediction. Next, please. So the idea we use is very simple, can be put really under the conformal prediction. This is all data you can see. Santa Clara, that's where California had a lot of cases and death relative to the other counties. We just look at the last 5 days and look at the relative prediction error for our method. And then we take the maximum. Next, please. And then we just add up to the prediction, top and bottom. Since we're looking at the cumulative deaths, if we go beyond the last death we observed, we should definitely truncate there instead of just going below, and that's the interval we get for the prediction error. And we can do some calculation. If the prediction error in terms of relative scale are exchangeable, you can show that this way we'll get about 83% coverage. So that's kind of a rough calculation. And next, please. This is to show that if everything's exchangeable, you show the ranks of the different residuals will be more uniform, and between 1 to 6, so the average 3.5. This gives you some indication. On average, we kind of okay, but there's variability. But the proof of this method is not really the theoretical calculation. It's really, we can just see how this interval really cover the observed death counts, because we have many, many days to come and many, and that's what the empirical measure in the conformal prediction analysis. Next, please. So here, see, if you look at the period, the first period, April to May, then the coverage, we aim at 83% under some, observed seem to be okay assumptions. And most of the intervals coverage is actually above 80%. There are a few below. And if you look at it, it's because a lot of times there's a sudden jump. Either just something happened, there's a super spreader event or something, or it's because a revision of death count. So and then the method have a hard time catching up. And if you look at the May 11 to 12, the coverage is still pretty good, but the intervals are relatively long. But if you only look at the days where you have enough deaths, that's what we're really aiming at when the PPE will be in shortage, then the interval size is a lot more decent. Next, please. Next slide, please. So now we have seen that we have now an interval which has pretty decent coverage. Then we move on. Chandon, actually is my deputy, a CS student in my group, start building a website. And we start displaying a lot of our results at our website. So that's still up, called covidseverity.com. Next, please. So this is behind the covidseverity.com. It's really an automated AI system. We did curation of the static features about health and density, economic, socioeconomic situation, all of that. And that's already put in there. We're still adding some things when there's opportunity. But the daily counts are scraped automatically from US effects. And we do some automatic cleaning, as I'll show you, that doesn't always get to the problem. Like this 1,000 like change, if you human look at it, you know that it's an error, but the machine didn't know. And then our CLAP prediction algorithm runs on automatically using AWS. So thanks to AWS for supporting us. And also we have our MAPI intervals also calculate. MAPI means you use the maximum of the past prediction errors. And the AI system could not spot the problem, as I mentioned, that the King County, Washington was just later got corrected. So humans in the loop would be better. So I have been kind of the only human in the loop. Each time I give a talk, I look at the website and spot something and then let the people fix it. So I hope more people look at it. And there was one person actually just somebody out of blue really helpful, find some also debugged for us too. So we really need a human in the loop, but right now it's mostly the machine doing the job. I'm the only human go there while I give a talk. Next slide, please. So I see the future of AI as human-machine collaboration. So this is just a snapshot of our website. That's the front page. We have on the left is the total cumulative number of cases, because I have to submit the slide earlier this week. So that's where I did the 12th last week. And you can press the blue button, which I'll show you. On the right-hand side, I'm trying to go a little causal, but not quite there. So did a little work, hope other people find useful. Give you a way to cluster different counties and do some offset when there's 1 or 2 cases. Or you just say, that here's the county, find the 5 counties most close in terms of the trend. So some minimum ability to cluster. It's beginning of I'll say causal investigation, which is very difficult. But if you use the operational definition for causal inference, which is you want enough evidence to act, then we're definitely in causal inference, not in terms of mechanism drive, but I like that definition. I think it's from Nancy Cartwright from Stanford, and this is where I read her paper. It's just like you want enough evidence to act. And that in that sense, we are in a causal inference framing. So we have some data over the summer on the policies, but we haven't really done much except putting this out. Hopefully other people find it useful too. Next, please. So you press the left button. We have 8 metrics to really show you the map, right? This is November 12th. You have cumulative cases, cumulative deaths, new cases, new deaths, and normalized by 100K. This is what our press is, new cases per 100K. This is November 12th. And then you can also do a search. I put there Philadelphia County. You can also go to county. And on the left, we have the top 20 counties, whatever the metric you choose, one of the 8. And if you look at the top few, actually, they are the counties have very few population. So it's not really trustworthy, you just do the raw count. They have like a few 1,000, and then if they have 1 or 2 cases, it gets blow up. But you can search for your own county. Next, please. This is the same map last time I gave it a talk. So you can see things got quite a bit worse, right? Just visually, you know. Even some of the very dark ones is a little lack of data or things very variable and got blow up. But still, there's clear evidence things got a lot worse since 6 weeks ago. So you can search next one. So this is Philadelphia County, right? Since I'm giving a talk in Temple. You just look at the blue curve. So the blue curve, we also do prediction of cases. And deaths, usually there's a lag about 3 or 4 weeks. So deaths is still pretty calm, but the blue curve, you can see that in like October, just got picked up. There's definitely a slope going up. And on the left, you can see our confidence interval, prediction interval, still pretty decent for death. And case is not as ideal, but we don't miss too much. We didn't tune the method for case. We only studied for death, but we just use the same method for cases. And so the death is still pretty decent, around 80%, but definitely the case number is picking up in Philadelphia and in the rest of the country. Next, please. And this is new cases in Philadelphia County. The blue curve just picking up. Death is still low because there's a delay. So hopefully we know treat better. That's what I'm hoping for. Then we won't see as a huge death with the number we have. Next, please. So how Response for Life, right? We very much was doing this modeling work to help Response for Life to distribute PPEs. we went for a pretty heuristic approach. So they built a Salesforce logistics system. We end up developing this severity index. We predict at county level deaths, and we use the total number of employees of the hospital in the county to impute death count to different hospitals. And then we have the both cumulative deaths, as you said, the area severity, and then we also have the new count prediction. And then we cut into 3 categories. Both are high. We have high, medium, and low. So this is the indices the person who distribute will use, and we upload our predictions systematically to the Salesforce system, and they use it. We didn't really put into optimization. Even I recruited people to work with us, it was not called for. So we end up with this heuristic, like very categorical indices to use. Next, please. Actually, one of the shipment we did was to Temple University Hospital. 2 people I want to thank we work closely with, the founder of Respond for Life, Rick Brennan, and Don Lamworth was really the lead for the logistics. We work with Aero Bridget, like a group of pilots with planes, ship things for us because Rick is a pilot. And this is shipping on May 8th to Temple Hospital. And I think they helped us to distribute to nearby hospitals. Actually, one problem we had was we couldn't connect with hospitals at will. We call them, they don't know who we are, they wouldn't want to receive the shipment. So we can only use the places where we have contacts will receive the shipment. Next, please. So this is the Salesforce Response for Life system, and our severity index is uploaded daily, still now, but right now I think Response Life is now very active. And we work with maker spaces, Maker Nexus, and different local maker organizations to do. And also this Get Us PPEs. It's a residential medical doctors system because they have connections with hospitals to receive the shipments. Next, please. So as Edo mentioned, the paper appeared 2 weeks ago at Harvard Data Science Review. And when we submitted the paper, it was kind of, the reason actually we submitted the paper was because the website was up and running. We feel we need to make our work reproducible, and you have to document it, not just the code, but also how we did it. So that's why we wrote the paper. And for the revision, we had very, very good reviewers. So the paper became double the length. A lot of data quality results were added in the revision, not in the beginning. We just try to record what we did to support the website. Next, please. To summarize, the CLAP and the MAPI prediction interval are really generally applicable. We develop a linear exponential and some other predictors, but you can use your own predictors. Some are basically based on agent model, and this CLAP methodology we're able to combine and help to take the advantage of the best predictor, I would say soft way instead of hard choice way. And the MAPI methodology uses the past prediction interval, like prediction errors is also agnostic to the predictors, but you need to check a bit exchangeability for at least the period you're looking at. Over the summer, we worked on county level prediction for hospitalization, and we had UC hospital data. We really want to go to the facility level. We built a website, we didn't put public for hospital to maybe use upload the data and predict their own hospitalization. We've been waiting for data from public health department, California State. So far, we haven't had access to that data. So we're still kind of finishing the work and hopefully get some data, more data. So the same methodology works for hospitalization with different initial predictors. Moving average works much better. So we change predictors, but not this CLAP and MAPI methodology. Next, please. To summarize, so this data repository is up and running. It's always there, and a lot of people have been using it across different universities and even some research organizations, and some actually startups contact us about the data. And the CLAP and MAPI are simple, transparent, and we actually right now still upload the data, but I think response line is not as active as in March. And we also support webpage Atlas at the University of Chicago. Next, please. So we are providing our prediction to a CDC forecast hub. Now many people doing county level prediction, and we're still in the middle of finishing the hospitalization prediction with different basic predictors. I'm kind of still on the verge of doing some causal investigation, but unclear there. We have policy data and haven't really made a decision yet whether to go there. Next, please. So the codes and data up there, and the website is called covidseverity.com. So hopefully you find it useful. Thank you.
Thank you very much, Bin. This terrific work. I think the index, the paper, the repository on GitHub with data encoded in the website are going to be a tremendous resource. I also want to say this is really the quintessential data science project. It's complex, it's collaborative. Statistics and machine learning methods have been tailored to answer the right question, the important questions, and also it's mostly automated. And like you said, having more humans in the loop would be great. And so I encourage everyone here listening today to take a look at the website. Thank you again for your perspective, Ben. That's been great. I'm now going to turn it over to David Madigan. I'd like to, David Madigan recently moved to Northeastern University from Columbia University. At Columbia, he was, one of the driving forces behind the Observatory for Healthcare and Data Science and Informatics, following on that work, which is, one way to think about it is how to produce reliable and causal inferences from very complicated data sets that, all speak to the same question, but, they are hard to have them to work together. So he's an expert in this sort of area of research, and I think he's going to tell us about his more recent work on Legend, which is another project in that spirit. David, I'm going to turn it over to you. Thank you for being here.
Super, thanks, Edo. I'm very happy to be here, and slight change of direction here, unlike my fellow panelists. And I'm not going to focus entirely on COVID, although I will touch on it in a few minutes. So what I'm about to talk about is, or make remarks about, is a body of work that's been going on for 6 or 7 years under the auspices, as Edo alluded to, of a collaboration called Odyssey. And anything and everything I'm talking about you can find on the Odyssey website. The URL is there. So I'll come back in a few minutes to say some more about Odyssey, but I want to start in a different place. So next slide, please. Thank you. So what I want to talk about primarily is, if you will, a kind of a genre of work or of research in the healthcare space. So medical journals are full of papers like this one. And I'm not picking on this one in particular, it's just that it's a very good example of the genre I'm talking about. So what's going on here is a group of authors who are studying essentially a causal inference problem in the healthcare space. They're comparing different drugs, 4 of them there, apixaban, dabigatran, rivaroxaban, and warfarin. These are blood thinners. And they're looking at the risk of major bleeding in patients with atrial fibrillation, a comparative analysis of this risk across these 4 drugs. So the analysis they did, they conducted it in a very large US-based claims database, insurance database, that has, of the order of 100 million patients represented in the database. Much of the evidence that is guiding the practice of healthcare as of 2020 is coming from studies like this. It's no longer coming from randomized trials. So we have access to, we as a society, as a globally, have access now to massive scale electronic health record data, be they administrative claims databases like these good folks are using, or electronic health records that are generated during the practice of healthcare. But we now have multiple years, as I'll get into some more specifics in a few minutes, multiple years of data for hundreds of millions of people around the world, and the enterprise of generating reliable evidence about the practice of healthcare to guide the practice of healthcare from these databases is a massive enterprise, globally. So it's very important. This is where most of the evidence is coming from. So my basic point that I'm going to make is that, in a sense, the way we go about doing these studies is pretty messed up. Not to get too technical at the outset. There are real problems with the way we do this. So I want to zero in on a few of these problems. I could talk for hours about it. I won't. And then I want to describe what I think is perhaps a better way of generating reliable evidence from these large-scale databases. But before I do, let's just look at this study a little bit more closely. So, as I said, they're comparing 4 different treatments in a cohort of patients with atrial fibrillation, and the outcome is major bleeding risk. The paper, like all papers of this type, it produces a statistical artifact. So in this case, for instance, they're looking at comparing matched rivaroxaban patients, that's one of the drugs, as compared to apixaban patients. So they're doing a pairwise comparison between 2 of the drugs in here. And they're saying that the rivaroxaban patients had essentially a doubling of the risk. They were twice as likely to have a major bleed than the apixaban patients. And there are other conclusions in this paper, but that's one of them. And that is exactly the kind of result that then guides the practice of healthcare in terms of which drug would you prescribe to which patient. Crucially here, they produce a statistical artifact. It's a 95% confidence interval. And the basic idea here is, what a physician or a patient or a decision maker would look at that and interpret that to mean that 95% of the time an interval like this contains the true causal effect, right? The true effect size, which we could argue about what that means, but let's just run with that. So in this particular case, the interval goes from 1.4 to 2.4, and crucially, it's north of 1, so it doesn't include 1. So a typical interpretation here would be that this is solid, this is statistically significant, and you can proceed as if there really is an effect here. Now, there's a problem, which is we don't actually know what the coverage of that interval. I've been talked quite a bit about coverage in the predictive context. Here I'm talking about coverage in the inferential context. But we don't actually know whether this interval covers the truth 95% of the time, or 50% of the time, or 100% of the time, because there are basic simple assumptions that go into the underlying math here, which we know are false. So the basic assumption is that one of them is that you have an unbiased estimator. We know that's not correct in these kinds of studies. There are many sources of bias that bedevil these kinds of studies. So work that I've been involved in, and many people have been involved in, to try and establish the operating characteristics of studies like these, suggests that the true coverage is probably in the 40 to 60% range. It's not like 93% or 96%. It's way off, right, in practice, almost certainly. So in other words, the interval, a 95% interval here, should probably look something more like 0.5 to 4. So we're proceeding as if we've nailed it, we know what's going on, when in actual fact, we really don't, because there's no basis on which to assess the coverage. Next slide, please. So that's problem number 1. We think it's 95% coverage. It isn't. Kind of demonstrably, it's not, and therefore decision-making pursuant downstream from this is sort of intrinsically unreliable. Next, please. Another problem with these kinds of studies is they're not necessarily pre-specified. You actually have no idea what these authors did, what the process was that yielded this egg, if you will, that they lay, in the paper. And in particular, you don't know if the analysis that they're reporting here was pre-specified. So did they try 20 different analyses and choose the one they liked? And it's not necessarily nefarious. They might have thought it was the best analysis, but there's no suggestion in here that it was pre-specified. That's typical of these papers. Next slide. Is it reproducible? I guarantee you it's not. meaning if a second group of authors set out to, to run this analysis and reproduce these numbers, they couldn't. And there are many reasons for this. It's a complicated, interesting societal problem. But let me give you one little kind of insight or snippet as to why you can't reproduce a study like this. There's a statement in the paper, very typical of this, that talks about baseline patient characteristics that included age. Okay, that's fairly well defined, maybe, although you don't know whether they categorized it or not. Gender, geographic region, how defined? Clinical characteristics and baseline medication use. Good luck trying to reproduce that. And it's essentially completely impossible. Next slide. Is it generalizable? Does this apply to me? Does it apply to you? So this model, this analysis was conducted in a US-based claims database, so people who are insured in the United States. Does that apply to people in Korea? Does it apply to non-insured people in the United States? So the major questions about the generalizability. Next slide. In essence, the process right now that produces these kinds of studies is entirely kind of artisanal. It's like it's an arts and crafts kind of a business. It's you're relying on the skills and the scientific kind of prowess of the folks doing the analysis. It's like, and I've literally heard this. Trust me, I'm a good analyst. I know what I'm doing. It's a good result. So it's a very unsatisfactory state of affairs in terms of generating this is the evidence that's guiding the practice of healthcare. It's really quite scary. Next slide. So I hope I've given you a flavor of why the current state of affairs is in very many ways problematic. So now I want to switch gears and talk about a new approach that we call Legend, that has been developed in the context of the Odyssey collaboration. I don't for one second think this is the last word or the best way of doing this, but I think it has characteristics that are desirable, and I'm hoping it leads to a significant improvement in the way we generate evidence going forward. So what we sought out in developing a new approach is we wanted something that was reproducible, so you could go back and literally perfectly reproduce any analysis we do. We wanted it to be systematized, so none of this artisanal, I decide to adjust for this and I decide to exclude that and so on, but a systematized approach that is essentially automated and done at a very large scale and entirely open source. So that the code is available, the protocol is available, completely pre-specified analysis is what we sought out. A key aspect of the approach, or a key characteristic, is the use of negative controls. So this is not a new idea, it's been around for a long time. The Legend studies are doing it perhaps on an unprecedented scale. Basic idea is very simple. Let's imagine we're studying drugs, it extends to other medical interventions. But a negative control is a drug and an outcome where it is, quote unquote, known that there's no causal association. Okay, so there's a bit of a circularity to this, which is if we don't know how to do this causal inference, how do we know that something doesn't cause something else? Suffice it to say that we have developed a very large scale, algorithmically driven approach to identifying negative controls. We could have a good argument about how good it is, but it's at least a step in this direction that is transparent and reproducible. We derive these negative controls from very large scale literature crawls, from structured analysis of product labels, and also analysis of so-called spontaneous reports. Therein lies a lengthy story in and of itself. We identify negative controls. This enables us to produce what we refer to as empirical p-values. So rather than statistical artifacts that rely on wildly unrealistic assumptions, we simply generate statistical artifacts from basically how well do these methods do on the negative controls, where we quote unquote know the answer. It's a long story, and I'm happy to provide references to the various papers that describe it in detail. We also utilize positive controls, which are drug outcome pairs with a known effect size, and our current approach is to simulate these using very large scale models that enables us to produce calibrated confidence intervals. I would describe this as a work in progress. There's a lot to be done. Next slide, please. So let me just give you a quick flavor. I don't have a huge amount of time. Let me give you a quick flavor of this approach in action. So in 2017, the American College of Cardiology and other organizations produced new guidelines for the management of hypertension. Hypertension is extremely common in this country and around the world. This guideline is hugely important in terms of the actual practice of cardiologists and physicians in general in managing hypertension. 56 pages, 106 recommendations. They very carefully discriminated between recommendations that were expert opinion, and then they had gradation from all the way from expert opinion to guided by randomized controlled trials. Next slide, please. Next slide, please. Thank you. So in this guideline, they considered, if you look at all the different treatments, pharmaceutical treatments they considered for hypertension, there were 39 different drugs that they considered in this analysis. They formed different drug classes, but 39 different ingredients. And the slide there on the left, or the circle on the left, just shows you how common these different drugs are in a particular database in the United States. So it's kind of the Wild West in terms of the array of drugs that's used for hypertension. Next slide, please. So they considered 39 treatments in the guideline. 58 different outcomes of interest were mentioned. So these range from bad effects of these drugs, adverse effects, to good effects of these drugs. There are 58 of them. Next slide, please. The 39 drugs are arrayed around a circle here on the top half of this slide. And what we've filled in here is we've put in a line inside this circle for every head-to-head comparison of a pair of drugs for which there is evidence from a randomized trial. So as you can see, there's a huge dearth of evidence. And indeed, many of the recommendations in the guideline are based on expert opinion, what experts think, rather than actual evidence. So our goal in this, in the LEGEND study we did on hypertension, it's one of several we have done, is to basically go from the left-hand side to the right-hand side. We wanted to fill in the circle and generate reliable, reproducible evidence with known operating characteristics for every possible pairwise comparison in this circle. You can't actually do all of them because even though we're dealing with very large-scale databases, you run out of data for many of the comparisons for the less widely used drugs and the less common outcomes. But in any event, it's over 10,000 comparisons. We conducted this study globally. So what we did is we did a head-to-head comparison of every pair of drugs, that's 39 choose 2, for all 58 outcomes, using negative controls and positive controls in an array of databases that are listed there, that they don't cover the entire globe, but it's a few 100 million patients in different parts of the world. So US, Japan, Korea, and Germany included in this. The full Odyssey network, I'll get to it in a second, I'll talk about it briefly, is bigger than this, but this particular study we conducted in these databases. Next slide, please. I think there might have been a second slide there. There we go, thank you. So here are the results, so to speak. So in the end, our study produces 1.3 million estimates. So we're doing what some folks refer to as the all by all, right? All pairwise comparisons of these hypertension treatments. We're filling in the circle, right, for all 58 outcomes. And let me orient you quickly with this picture. The horizontal axis is the point estimate, where a hazard ratio of 1 is the neutral value. The vertical axis is the standard error. And these dotted lines give you that's the boundary for classical statistical significance at the 5% level. For this analysis of that 1.3 million estimates, 83% of those confidence intervals include 1. It's not 95%, but it shouldn't be 95% because one assumes that many of these are real effects. But every single dot on this study is backed by full automated diagnostics and actually a full paper. So we can generate 1.3 million scientific papers, and have done, that describe every single dot in this picture. Now, that's what it looks like, basically, if instead of cherry picking and studying one thing in an artisanal way, basically fiddling around and producing a result, This is a systematic, automated, complete analysis of hypertension drugs for these 58 outcomes. Next slide. Keep that picture in your head while I go to the next slide. That's what the literature looks like. So if you do a crawl, which we've done several times, of the literature of observational studies, that's what it looks like. There's disastrous clustering just under the 0.05 level. This is p-hacking, right, that we all know about and talk about. So go back a slide, please. Actually, if you could just go backwards and forwards a couple of times, please. That's what it looks like when you don't have, you're not doing pre-selection and fiddling around. That's what the literature should look like. Go forward a slide. That's what it actually looks like. We have a problem. We have a real problem. Next slide, please. Oh, sorry, I should have said it before I get there. In the previous slide, 85% of the results were statistically significant. When you do this more honest, I would claim, analysis, it's the other way around. 85% are not statistically significant. I invite you to look at that. It was published in Lancet a few months ago. There's several other legend studies that are either published or in the works. So briefly, this is in the context of a collaboration called Odyssey. So the Odyssey is a community. It's a global community that is basically studying these kinds of analysis and trying to come up with better methods for generating more reliable evidence from large-scale healthcare data. Next slide, please. There are about a couple of thousand people around the world who are active in Odyssey. There are dozens and dozens of working groups within Odyssey. There are Odyssey symposia in ordinary times. In Europe, in the US, in Asia, there are sections all over the world. Odyssey members, many Odyssey members have clinical data. They sit on data. The union of those databases has about 700 million patients in the databases. So conceivably, you can do an analysis with about 10% of the world's population and growing. And the reason why this club is so to speak, how I think of Odyssey, is growing rapidly and gathering such steam is a common data model. So we have developed something called the OMOP common data model. All of these databases, it's now around 100 databases around the world, have been mapped to the common data model so that you can write an analysis, implement an analysis. There's a huge open source library to help you do that the community has developed, and deploy it anywhere in the world on any of these databases that has been mapped to the OMOP common data model. Next slide, please. Briefly, the community is looking at population level estimation. That's what I just talked about. But there's also a huge amount of activity related to patient level prediction, personalized medicine, if you will, precision medicine in these databases. And also a lot of very interesting work going on in clinical characterization, trying to understand the practice of healthcare now that we have data on this kind of scale. A quick mention of COVID. This kind of asset, if you will, and network around the world is tailor-made for studying things that are where you want to do rapid, large-scale studies. So the community has developed an outpouring of papers using the Odyssey network studying COVID. And these are just a few of them here that have been produced in short order. Next slide. So finally, what I'm really talking about here is the power of an international community and a truly global data network. I believe that we are using it to generate real-world evidence, in a much more reliable. We're not, this isn't the last word, but I do believe it's more reliable and certainly reproducible than the classical artisanal approaches. The common data model here can't be underestimated in terms of the power. You can't do this kind of science without a common data model. Obviously, if you had to write the code 100 times for 100 different databases, you're dead in the water. It can't happen. So the power of the common data model is absolutely amazing in terms of advancing science in this area. But needless to say, much work remains to be done. I invite anyone listening to this to go to the Odyssey website and join. Just join means just sign on to one of the working groups or the forums or whatever. It is an open and welcoming scientific community. Thank you very much.
Thank you very much, David. I'm a big fan of this thread of work, and I think the idea of negative control hasn't been leveraged enough really in any area of science or industry where wild predictions abound, coming from complex databases. So thank you for reminding us on that. It's not just used for estimation, but I guess a more reliable model is also better, more generalizable and, better for other sample predictions, I imagine. Right? Okay, so we did receive a number of questions, but unfortunately we are running out of time for this panel. So I will just say, on behalf of Temple University, the Department of Statistical Science, the Fox School of Business, our partners at Wells Fargo, thank you very much to Nicholas, Bean, and David for presenting our perspectives here today. Thank you for your time. Really appreciate that. Thank you.
Thank you.
Thank you very much.
go.
Well, thank you to all of our participants in our first session this morning. That was a great great exchange, and really appreciate everyone's inputs. Very well done. Which brings us to session 2, and we have a great topic this morning here. It's deep learning and AI. Has a revolution happened yet? And we've got an outstanding roster of professors to discuss these topics today. Starting out with Don Rubin, and Don is the Emeritus Professor of Statistics, Harvard University, and also Distinguished Professor of Statistical Science in the Temple University Fox School of Business. Also joining us this morning is Michael Jordan. Michael hails from the University of California, Berkeley, where he is a professor of statistics and computer science, and the Pihong Shen Distinguished Professor. Michael, thank you for being here this morning. Also with us, David Donahoe from Stanford University. David is a professor of statistics and the Ann and Robert Bass Professor of Humanities and Sciences. And joining us all the way from Germany, we're very happy to have Michael Kohler this morning. Michael hails from the Technical University of Darmstadt, and he's a professor of statistics. Thank you, gentlemen, for being here with us. And Ed, I'll turn it over to you to begin our session. Thank you.
Thank you, John. I also want to welcome and thank our distinguished faculty guests on behalf of the Department of Statistical Science here at Temple University. So in this session, we're going to take a deep dive into data science and artificial intelligence to better understand these modern phenomena, I would call them. So if we take a brief look at the history of statistics and computer science, we often see ideas that spark research areas, and sometimes they grow into something bigger. And the path to growth is never the same, however. So I want to just give a brief example. 25 years ago, with the increase of information collection and storage in the industry and the sciences, data mining, the idea of data mining, emerged as a new set of techniques at the time. And at the beginning, in our profession, data mining was almost a pejorative term. Somebody could say, oh, look at that scientist, he's just data mining. But following innovations in fault discovery rates and other strategies to control errors family-wide, today data mining can lead to accurate predictions out of samples, and also data-driven scientific discoveries. There's other ideas like big data, for instance, that have been more of a fleeting meme with little to no technical content to support it, somebody would argue. And there are many such examples of big ideas, including machine learning, compressed sensing, data science, deep learning, and artificial intelligence. So there are many factors that determine whether an idea is going to be successful or not. And I would say what many successful ideas have in common is that they sustain industrial and scientific progress or can inform policy making. And as a consequence, we see new conferences being organized around an idea, new scientific journals, new technical journals, publishing papers around an idea, new academic programs, teaching the skills that are required, to master an idea, and so on and so forth. And so with this sort of brief background in mind, now I would say data science and artificial intelligence have proven to be very special ideas that keep coming back, being rediscovered and revisited over the years. And so if we consider data science to start, for instance, most top universities nowadays offer a program or multiple programs in data science and have devoted other significant resources to data science related initiatives. Some of the academic departments have even renamed themselves to include data science in the name of the department, and the demand for data scientists in industry is at an all-time high. So to understand this phenomenon more in depth, I'm going to turn it over to David Donahoe, who has recently written an informative and influential piece about data science. David, turn it over to you. Thank you for being here.
So first of all, let's just sound check. Are people hearing me? Okay, and secondly, I just wanted to discuss a copyright matter. I'll use a number of results of Google image searches, which any of you could do for yourself and find, similar images. They may be copyrighted, but they're only being presented here for non-commercial educational purposes. Now, about the title, the revolution has happened, but credit has been stolen. So, of course, this is an homage to Michael Jordan's nice article in the Harvard Data Science Review, "The AI Revolution Hasn't Happened Yet," which perhaps he'll tell us more about, and is also, of course, used in the title for this session. What I wanted to do here was to clarify some things about what's actually happened and the language that we should use for talking about it as a way to kind of improve our ability among ourselves to really understand what's going on and what's likely to happen next. So I want to point out that in the last 10 years, there really has been a revolution that's taken place. And we're all very fortunate to have lived through this revolution. We will be marked for the rest of our lives by the fact that we knew the world before the revolution, and we will be part of what comes after the revolution. And we will recognize this as the largest civilizational event that has happened certainly in more than 100 years and perhaps 100 years in the future. Next slide. The revolution has its roots in what I'll call the smartphone revolution. 10 years ago, if you went to India, as I did, and you took a standard guidebook, then they would tell you that if you went into villages, there you would see things outside of the usual touristic sites. You would see things there that really hadn't changed in 2,000 years. Basically, there were farmers who maybe owned a cow and maybe lived in a dung hut and maybe burned dung. And the information that they had was just what was passed down by word of mouth from the other farmers. What has actually happened in the 10 years since is that smartphones became quasi-ubiquitous. They've, of course, gone through various generations. It started out with the, more traditional phones that didn't have displays, but today smartphones are needed just to be a farmer, a peasant farmer in any of the major countries like China, India, or any of the African countries where there's large rural peasant populations. And of course, this has massive consequences because the information available, particularly to young people, has completely leapfrogged any expectations that we could have had in 2010. I don't think anyone really saw this coming to the degree that it's actually happening. And it's very easy for us to forget the significance of actually putting all 8 billion humans in immediate contact with all information. Really, this is epical. We won't forget it. It'll become only more and more dominant in our thinking over time. When we think about what has happened that we've lived through, this is it. This is the big thing that will mark our lives. Next slide. Now, in the wealthy countries, of course, we saw the effects first. So what was kind of obvious was that human behavior was transformed so that there were, teenagers and other young people using cell phones for many hours a day and using them in ways that the older generation could not have anticipated or maybe wouldn't approve of, creating social media, using selfies, and so on. The word of the year in 2013 for the Oxford English Dictionary was selfie. So we may think of that as, you know, something that's been around forever. No, it was actually invented during this decade, as were many, many other human habits that we now consider completely second nature. So hours per day on mobile devices has scaled upwards and upwards so that it's now at the place of like 4 to 6 hours a day, depending on the country, depending on various particular habits. Another telling fact is that humans are now uploading on their devices more than 1 trillion images a year, just still images. And in the 100 billions of videos, just casual video taken for the purposes of maybe a TikTok or some other similar social media purpose. Okay, so we probably don't think about this too much. We think of this as simply kind of teenagers doing trivial stuff, but the consequences of this are utterly profound. And I don't mean the consequences on the cervical spine injury rate, which will also be enormous. I'm talking about the consequences that we had to build out a global computational and communications infrastructure to make any of this possible. Next slide, please. Because as part of this model, you're going to have 8+ billion people's devices checking with cloud servers many thousands of times a day. You have to build out a massive network of data centers. In some cases, you had to create new transoceanic cables in order to carry the fiber optics to places that had geothermal energy or that were close to the poles, in order to save money on the cooling of the data centers and exploit natural renewable energy. So here's, for example, a data center built, I think, by possibly by Facebook, that's north of the Arctic Circle in the lower left of the picture. And these data centers have, many, many thousands of computers in them. Amazon data centers all told have more than 50 million CPUs. And so just the infrastructure to do all the things we now take for granted that's utterly trivial is actually an amazing engineering achievement, and it's required a utterly massive capital investment on the part of Amazon, Google, Facebook, all those companies that are at the top of the league tables for market capitalization these days. Next slide. Now, as a corollary of this, there are many consequences. So I've already mentioned the unknown consequences that this development might have for children's social habits and maybe their psychological development. There are also unknown consequences for political development in India and Africa and China of all these peasants who previously didn't have any connection to what politicians were saying or doing, and who suddenly have the information that they never had before. And I mentioned, cervical spine injuries, which are going to be endemic and are going to affect all these young people who are craning their necks over the devices endlessly, so on and so forth. Well, those are many, many corollaries of this. I don't want to focus on them, but we will be living with consequences like that forever. What I do want to focus on is that a corollary of this global computational infrastructure combined with communications is that our ability to train machine learning models has completely been transformed. So that if we make a plot as shown here of how many, essentially an index of computational intensiveness as a function of year for winning models in machine learning competitions, they've gone up by tremendous factors, roughly a 300,000x increase in computational ability has been experienced during this decade as people exploited that global computational infrastructure. You can now, instead of doing things like you would 10 years ago of use your laptop or a desktop or a local cluster, you can scale up a computation to some cloud system and access 100,000 CPUs in really, utter convenience and simplicity. In consequence, very complicated machine learning models have been built, and we know that as a consequence of that, science now today understands that we can do things that we never thought we could do 10 years ago. So 10 years ago, there was a meeting in London between an American mathematician, computer science, who made a bet that he could beat any Go program on earth. And John Trump is his name, and he won that bet. He had carefully defined the rules so that there could be no communication outside the room in which it would be placed, and he had to play against a single CPU, running whatever software the opponents put on it. And he actually beat the competition. He's not the world champion or anything. But today, everyone knows that the world's supreme master of Go has been utterly destroyed by AlphaGo 0. And no one expects that ever in the rest of human history, it will be possible for a human to beat machines if we play on the home turf of what the machines want to play on, which is to use this global computational and communications infrastructure on their side. That's how the world is transformed. Okay, so this massive computational scaling up that's happened, it's completely changed what we think can be accomplished. And so we're in a new world. Could I just ask how we're doing for time? Because I'm afraid that I'm gonna run out of time here.
You're doing great so far, David.
How much more time do I have?
Let's say 20 minutes.
Okay. So next slide, please. So we've arrived at the moment of computing supremacy. Computing supremacy to me means that essentially humans are not in the game, ideas are not in the game. Nothing that we've traditionally considered as intellectually respectable is in the game. What's in the game is crushing computational raw power. As an example of that, I'd point to this recent paper from Google AI. I teach a class at Stanford, and last year at about this time, we had Orhan Firat from Google AI come and make a presentation about this. And, I was like so affected by the implications of what he was telling me that, well, maybe you should stay away from this if you're not really prepared for psychological challenges, or or maybe, you know, you need to do this kind of intervention where, you know, there's some particular psychoactive substances that help you digest the shock. In any event, next slide, please. What's in this paper is the description of an effort at Google AI to build a model that they use for translation. It is actually used in production today. Translates from any to any of 105 languages. The underlying model has 80 billion parameters. The underlying data that enables this has 25 billion sentence fragment examples. And it, you know, gets even more impressive as you learn like what their concept of how they're going to do this is. But, you know, just as an example, this can translate from, you know, Swahili into Croatian. There probably isn't any, you know, previous example of translating from Swahili into Croatian. Perhaps no one ever thought to do that before. And the particular way it's done, which is I found even more crazy, but like it's impressive that they can do it, is by translating images. Namely, there's just a picture of some text in Swahili, however that's rendered as text, and they create a picture of some text in Croatian. They don't even have an understanding that there's an alphabet, that there's like they don't use a dictionary. Like like who would do this? Well, this is what they do. This is literally how they do that translation. In order to train this model, it takes months of runs using all the fancy TPUs and equipment that Google AI has. And so they have many of these models training with small tweaks at any time. And, you know, weeks and weeks after they start looking in and looking at checkpoints and stuff. It's just an amazing edifice that's been constructed, and it's all in this last decade. This is an example of the revolution that we have just lived through, and we don't completely assimilate and understand its significance, even now. Next slide, please. Now, of course, what that revolution is that we're talking about could also be associated with the phrase data science. Namely, data science is sort of harvesting the corollaries of all this massive transition to computational supremacy. And I think the intellectual assimilation of that transition is much delayed, and we don't really understand it yet. And so there are a lot of habits of speaking about these things that are that reflect our lack of adjustment to what has just taken place. So just to understand the juxtaposition of the old with the new, I just mention here two famous articles. One, The Unreasonable Effectiveness of Mathematics in the Natural Sciences, and the other, The Unreasonable Effectiveness of Data, one by a Nobel Prize winner in theoretical physics, and the other by resident intellectuals at Google. The articles are roughly 50 years apart, and they stand for the transition that we've just gone through. We no longer speak about the idea that mathematics is going to save us. We assume that whatever mathematics might have done, well, it had its chance. We're done with that. Now there's a new game in town. It's the game of computational supremacy, and it's data supremacy. That's really what the second article announces. Next, please. There are, of course, massive differences between the two cultures. In the math first culture, which we had from the 1650s until about 2010, there were theory, models, you derived things, expressions, you did analysis, you reached an understanding. It was an academically driven field, and what it produced was discourse, articles, discussion along the lines involving all the steps that are mentioned here. In the data first situation, which really has been, out there, depends when you want to date it. I'll say it's since the 1980s been happening, but in specialized places that might not have been well recognized, but has really been so dominant since 2010. We don't have theory, we have empiricism. We don't have models, we have challenge problems of things that data sets and tasks that need to be attacked. We don't have derivation, we build things that we think need to be built. We don't derive formulas and expressions. We don't analyze things, we make measurements. We don't understand anything, we document performance. There is no academic component to this, it's industrial. There is no discourse about it, it makes products. I mean, the products could be predictions, the products could be stock portfolios, the products could be, strategies to do well in the Google Ads lottery. But it's a different game. Next, please. Now, for many people who have the academic background, they don't really understand that that theory is over and it's been replaced by challenge problems. So the challenge problems paradigm has been around since the mid-1980s, when the Department of Defense, DARPA, started funding challenge problems in various natural language processing and biometrics. So the fact that today Siri or Alexa can hear your voice and know who you are, and they can discuss, they can understand things that you're saying. It's all because of this paradigm, not because of some ideas coming from math. What the paradigm combines is a set of ingredients which has come to be called the Common Task Framework by Mark Lieberman at the University of Pennsylvania in the Natural Language Processing Group. It has these ingredients: a publicly available training data set, a set of competitors that have a common task that is to infer a class prediction rule from training data, and some sort of scoring referee, preferably robotic, who runs the class prediction rule against sequestered data that's not available to anybody. So this was started by DARPA in the mid-80s and has been used successfully in many biometrics and other natural language tasks. It more or less describes the way Kaggle and famous competitions like ILS-VRC, often called ImageNet. Next slide, please. And when it was used in the DARPA competitions, over the years, it had this amazing property that each year there would be really noticeable improvements in performance year after year. This was in the pre-deep nets era, and maybe people were using, you know, whatever they were using at the time, perhaps some electrical engineering derived filtering, some biologically inspired type of data representation, some kind of hidden Markov, you know, chains. Whatever they were using, it was just always getting better year after year. It's like a machine that produces progress. And of course, the key point is it's a contest. There's a lot of competitors and they get paid, which could mean, you know, grants. It could mean, you know, actual money, whatever. Next slide, please. The essence of this is that there's a human tendency to respond to leaderboards by energetic competition. And I'll just, you know, put this slide out there. Sebastião Salgado, very distinguished photographer. These are some pictures he took early in his career where he discovered an open pit mine in Brazil. And people just literally were, you know, digging in this open pit and carrying, you know, burlap sacks of mud off and making money based on how many little flecks of gold they found in there. It turns out there were doctors in there were professors, all sorts of people were inspired by this gold rush. And that's a perfect symbol for what these challenges have created. Next, please. A big event in the last 10 years was that Eric Schmidt, at the time chairman of Google, decided to write a check for several $billion to go on an unprecedented hiring spree, during which Google hired more than 1,000 computer science researchers. That's about equal to the number of computer science researchers in academia in North America. So they created essentially their own counter discipline of computer science. All of these people under one person's control, and they were set loose to push a certain technology, which because of one of these competitions, ImageNet ILS-VRC 2012, they believed this technology would be a good bet. And then next slide, please. So the task of ImageNet challenges was based on things that came out of Li Feifei's lab in 2009. And then next slide, please. Just like in all the previous cases, there was tremendous progress year after year. And it's thought that for this particular data set, the human level of performance is at about where the networks are today. So they became human or maybe superhuman because humans could not actually run through the whole ImageNet data set. There just isn't lifetime in them. But you can get the accuracy that humans can muster in small bursts. Next slide, please. I just want to emphasize that although deep nets have been said to be extremely unique and so on and so forth, this is not unique. This is what has always happened with these challenges. And there's no real difference between what we saw in ILS-VRC and what all the DARPA challenges did. The key point here is it's the data science revolution combined with the challenge definition that so drives machine learning that caused all of this. I don't see any evidence that there's a unique contribution of neural nets. What's unique is writing a check for several $billion and putting 1,000 researchers full-time onto one technology. Next slide, please. Which created, you know, among other things, all sorts of custom hardware was developed, and TPUs, and like even, you know, the next generation of Apple laptops, it's going to have stuff in it to speed up TensorFlow and PyTorch, like you know, changed essentially as a reflected effect from Eric Schmidt's writing that check. You know, all sorts of things have to be done now differently. Next, please. So, and that's where we are with this computational supremacy that I've previously shown you. Next, please. Next, please. On the other hand, there are a lot of things there that are problematic. So I don't want people to think that this is necessarily the greatest situation. There's resource insatiability because there aren't deep ideas behind this. It's all driven by an insatiable appetite for data, compute, and researcher hours. And because it isn't based on ideation of the traditional type where you needed theorist permission to do stuff, you do stuff that has no explanation, and then you make it up post facto, what you think went on. Both of these things are very inappropriate for universities, which is why academia is not in the game. But they're also unsustainable. Like the benefits that have been seen during this decade can't be sustained. For example, GPUs are not going to be able to scale in the way that they have during this decade. They've reached some limit. Next, please. So at the same time that we made 300,000x increases in computing, we made, you know, 17% improvement in classification accuracy. So this accuracy has been bought at a fantastic cost. Next, please. And, you know, the thousands of careers that have been thrown at this thing, none of those people are equipped in any way for a different technology or a different purpose than just carrying burlap sacks through a muddy slog up a hill. Next, please. And don't take it from me that the discourse is corrupted. Look at what the machine learning people in CS departments like at CMU or Stanford or elsewhere are saying. Next, please. So anyway, these are the cultural differences that have happened. Next, please. And the transition that is difficult for us to get used to. Next, please. Now, I mentioned that credit has been stolen, and I'm not actually suggesting that statistics is great and then, people are just hiding all the great stuff that we've done. I don't think that, these kind of snarky things like this cartoon and so on are necessarily right. But I do think that the quote at the bottom of the slide is correct. When you're fundraising, it's AI. When you're hiring, it's ML. When you're doing, it's logistic regression. That's a fundamental comment, but it doesn't mean that statistics has created this revolution. By no means. The revolution is definitely the data science computational supremacy axis. But the credit misattribution here is that there's some tendency to slap the label AI on this revolution, and it is not correct to do that. So I just want to make it clear that we have to know what the revolution has been. Next, please. In fact, AI is a miserable failure. What it's been good at is running to the front of a parade. In this particular case, they're running to the front of a parade, which is people trying to run them out of town. Essentially, what machine learning and the contest challenge paradigm did is show that you don't need any of the ideas of AI. Next, please. And a very profound commentary on this can be found in the blog post by Rich Sutton, who's a distinguished researcher in reinforcement learning, called The Bitter Lesson, in which he points out that basically everything that AI people who call themselves AI, have done is an utter failure. What has been a success is to never use ideas and just get more data and computing at the problem. And again, don't take it from me. Next, please. You can, Rodney Brooks has blog posts and talks where he says it'll be hundreds of years before we have general AI, and that most of the stuff that you see in the media about AI is just atrocious. Next, please. So after talking about, the idea that we've just gone through an AI revolution, he says in early 2019, the claims are ludicrous. Nothing has happened in AI in those 10 years. This is a professor of robotics at MIT who's as well positioned to say as anything else. Next, please. And we're hundreds of years away from anything like AI. Next, please. So we've lived through a transformation of civilizational significance, but we don't recognize it because we just think it's a bunch of teenagers making TikTok videos. What has happened is underlying it is the emergence of a global computational and communications network that's moved us into the era of computational supremacy. This creates all sorts of conceptual difficulties that we haven't adjusted to. It has almost nothing to do with AI. Thank you for your attention.
Thank you very much, David. Very clear, thought-provoking, at times depressing, I'll say, from an academic perspective, but thank you very much for your perspective. So I'm gonna turn it over to Dawn here, and going back to a comment that Dave made about AI, once you get down to the nitty-gritty details, is logistic regression. So I wanna ask Dawn to contrast maybe statistics and data science. So Dawn, could you give us some color about what you think the average data scientist is doing well today and what is doing poorly?
I'm not sure. Well, first of all, I want to make a comment about the terminology data science. There's this old expression, maybe it's from Tukey from years ago when I was at Princeton, that any field that needs science in its name is not science. You don't say chemistry science or physics science. Computer science isn't science. It's really engineering. And I think that's pretty consistent with everything David said, really. It's an engineering revolution where you take machines and you make them faster and faster, and you have to cool them to make sure they don't fry themselves. But it's not science. What is science? In my world, science means understanding nature. And physics is about understanding physics, and chemistry is about understanding chemistry. What is computer science about? What's engineering? And that's okay. But I think that the name is deceptive. Also, I also found part of what David said is kind of depressing. Maybe that's why I don't like to agree with it. Basically, I think he sort of implied that ideas are dead in the field, and so therefore it doesn't make a good academic field in that sense, where ideas are paramount. So why do we need ideas? Well, to me, ideas refer to understanding, and if you understand something, you can generalize beyond what you've seen. And I think that's something that's sort of missing from the usual machine learning attitude. You're always doing tests on these artificial examples, or sometimes they're real examples, but they're limited. And with respect to that, I think one of the big contributions of the field of statistics, starting with Fisher, and then there are a bunch of guys who I actually met. Jerzy Neyman, George Box, Bill Cochran, John Tukey, and David Coxto. The purpose of doing experiments is to learn and to get understanding. And I think that the understanding that is typically generated by machine learning or data science doesn't generate that. And understanding really means you understand something, or you have a hypothesis about why something's true, and you can address problems that are different from the collection of problems that have been presented. And in fact, often you get to do that by answering a different question than the one that's posed. And I don't think machines do that very well. They may be able to train machines to with the collection of images or something to become better and better at solving the problem that you presented to them. But humans have a different ability. They have an ability to be creative, and they can think about the problem that you've posed. And they often come up with a related but different problem that hasn't been posed. But that problem that they came up with is one that that has answers. So instead of addressing the problem being asked, humans have the ability to find a problem that's close in some sense, that wasn't posed, but is solvable. And I wrote something that was published in an obscure place when I was in Beijing last year, making this point that humans' brains are not wired like a bunch of computers. They change the problem into one that can be solved. And that's where I think many of the great ideas came from. So I'm not sure that I buy into David's future, or that it's or the game that will be played. I certainly hope not. It sounds sort of boring.
I guess David presented the dichotomy to be thought-provoking. Of course, there's a lot of details and ways for us to be in the middle, and I'm hoping Michael Kohler will speak to some of that toward the end. But thank you, Don. Thank you for being here. I'm going to turn it over now to Michael. As David was saying, the global computational supremacy, instead of AI, I should say now, has recently brought up a resurgence of interest, by chess and Go, self-driving cars. And one aspect of this revolution that I was stricken by was a series of papers by CEOs of Tesla and Microsoft or Bill Gates and Google writing in Science about how AI is going to take over the world and we should be wary of that. That sort of is one of the things that caught my attention, among other things, about this AI phenomenon. But I'm going to turn it over to you. Like Dave said, you've written about it in a nice article in the Harvard Data Science Review, in a piece that had several commentaries by academics, including Dave. And can you help us think through your perspective of the AI revolution, Michael?
Yeah, thanks for inviting me here. So just to say, I'd like to go through slides quickly, and I'm not the next person. I'm not hitting the button today. So whoever's doing that, be prepared, because I like to kind of move quickly. That's my style. So let me just say, I've really enjoyed it so far. It turns out that I think David and I agree on the phenomenon, and we agree on where you look to try to understand the phenomenon, which is really outside of academia. It's the outside world. And so the first part of this talk, I'm going to agree with him almost completely using my own language. But then I'm going to diverge. I don't have the same interpretation of where this is going and what the right way to think about this. There's going to be a little less depressive feeling, but that's okay. I'm in Italy and I can't get depressed when you're in Italy. So next. First of all, I don't like this phrase AI. I think David's totally right at the end. This is not about AI. This is not about intelligence of the humankind and putting it in the computer. It's about massive brute force data analysis and the implications of that. Okay, my view on this is that it actually is the emergence of a new engineering field. And I would not say just engineering. And we like to do science and that's just engineering. I think that's the wrong way to think. Think about chemical engineering in the 40s and 50s. Before the 40s and 50s, there was not chemical engineering. There was chemistry, there was quantum physics, there was fluid flow. There was a physical understanding of the world at the level, amazing level. But then people thought, is it possible to build systems that do this at scale? Could I make a factory that takes in inputs and produces outputs, which are new products, new materials, plastics, new kinds of clothing, things that have changed the world, arguably more than anything we're talking about right now. And in the 40s, 50s, young people, this is what they were excited about. And to develop this field, first of all, they had to try it out. They built some factories, some of which didn't work, some of which exploded, some of which just didn't make the product. And money was made, money was lost. There was a Wild West moment. But there was also the development of a field called chemical engineering. And it really arose in that era of people both being inspired by the physics and the chemistry, but also inspired what's happening in the outside world and trying to make sense of it. And new principles were developed, new ideas, as Don was saying. It wasn't just engineering, quote unquote, it was new concepts, new thermodynamic ideas at scale. And if you become a major in chemical engineering now, you're not just learning engineering tricks, you're learning a whole bunch of mathematical concepts that were figured out. And years later, we have had a successful field that has changed the face of civilization. It's had its problems because it's a powerful technology. I know less about the history of electrical engineering, but I'm sure it's very similar. Go back about 50 years before that, there was electromagnetism, there was Maxwell's equations. What more do you need? You have everything. But then people thought, well, is it possible to electrify a city or a country? How could I bring power across vast distances? How could I bring power into a home? How do I build circuits? So principles like impedance matching, which were sort of implicit in electromagnetism, but weren't really brought out, had to be brought out so you could make modular systems and make them work at scale. And you could start to make them work at planetary scale. And new phenomena started to emerge. And then new mathematics was needed to support this. And that field is called electrical engineering. And if you get an electrical engineering degree, you know a lot of mathematics, all right? So I think that's actually what's happening right now. We have 3 centuries of inferential thinking, inferential ideas, and algorithmic ideas. I think computer science actually is not just engineering. It has a lot of real ideas in it. And if you put the two together, you start to get what we might call data science. And you start to get this planetary scale flow of data and flow of value and flow of business models. That's what we're actually seeing in the outside world. And that's just like in the 40s and 50s, people building chemical factories. We're doing it without really knowing what we're doing. Sometimes it works and great things happen, like a search engine. Sometimes, cell phones work. Other times, really bad things happen, like, election manipulation or fake news and all that. And we're just kind of making it up as we go. And so what we need is a new field of engineering, which has its principles like impedance matching or thermodynamics at scale, that learn how to talk about human desires, preferences, and values at planetary scale with data flows as the underlying currency. So economics, microeconomics talked about a lot of this, but they never had data flows and compute. David's right about the compute, but it's not just the compute. It's the data flows and the value associated with data flows. And we need a language to talk about that and a language for design and analysis. Next. Okay, so ML/AI is just a small piece in this bigger picture. And I'm going to move away from that phraseology. I think ML is kind of fine. But if you want to use that for terminology, you have to recognize there's two sides to it. One of them is pattern recognition, which is typically labeled data sets and massive amounts of data and finding the patterns that allow you to sort of interpolate and in some sense narrowly generalize. And that's what the neural net and the deep learning and so on have been about. And it's become a commodity. So you can have massive data sets, but also the software is available. Right? Is that everything? Well, there's some people in the ML community who argue it is. You know, if you can predict really, really well, you can do everything. I totally disagree. And there's another side of the field, which is also active. It's just less prominent. It's the decision-making side. And it has to do with making high stakes decisions, not deciding whether there's a bunny in the image or something like that. It's like, should you have a heart operation? And it's about explanations for decisions, and it's about sequences, about simultaneous, and it's also about multiple decision makers and market mechanisms. If you don't start to embrace this and you're building systems that are helping making decisions at planetary scale, then you're not actually building systems that are going to work. Next. Okay, so if this is all true, what I'm saying, you should have seen it in the outside world. This shouldn't have been an academic invention that was somehow picked up by people and eventually led to something. It should have already been present, just like chemical engineering was present. And I think it has been. So I think the first generation was already in the 1990s. Companies like Amazon and eventually Alibaba and so on built back-end systems that could do things that humans could not do. For example, fraud detection had to be brought down to 0.01% instead of 3%. So you could do commerce on the internet. Otherwise, you couldn't have done commerce. And how do they do this? They take in massive amounts of data. They built computer farms. The origins of the cloud were there. Okay, it wasn't for AI or any of this later stuff. It was for building fraud detection systems back in 1990, right? And they did it really well, and they built systems that brought it down to 0.01%, and you could do e-commerce, okay? And humans can't do that. Even more importantly, supply chain management, right? If you're selling 1 billion products, which is what Amazon and Alibaba are currently doing, to hundreds of millions of people, you have to have a model of the supply chain that's extremely detailed and extremely accurate, extremely well calibrated, getting ships across the Indian Ocean, how long does it take, and so on and so forth. And they did that. And they did that with huge, massive amounts of data and compute, okay? So that's the area it was actually done, and that led to billion-dollar industries and has changed our world. So it's already sitting there. And that was a big engineering system kind of done hook by hook or by crook, all right? The second generation to me was the human side. You realize that a lot of this data wasn't just about supply chains and ships and, you know, trains and all that. It had human data in it. And so things like recommendation systems took human transactions, preferences, and so on, and led to making predictions that help people with their decision making at scales of hundreds of millions. E-commerce, social media started to rise in that period. Same underlying technology, same underlying big farms of computer systems. Eventually, the cloud started to emerge in this era, and same massive data sets, and same sort of thoughtlessness about what it was all meant. But it led to a billion-dollar industry. All right, this third generation is what I think is happening now. It's what I would call pattern recognition. It's the deep learning, it's the speech recognition, computer vision. And I'm less impressed than David is. Okay, so translation, yes, you look at Swahili, you go into Croatian, it's really striking. But there's zero understanding of those sentences happening. And I speak multiple languages, and I always see errors, even to this day. They don't quite get it because they're not understanding what's being said. Oh, they're copying strings to strings, or as David said, images to images. If I start to have a dialogue with one of these systems, or if I have a dialogue with David, he and I are going to build up a shared understanding of what the heck we're talking about. Maybe there's some event in the world we're talking about, it's going to happen tomorrow, and somebody's going to come and this is going to happen. I'm going to start to form a mental model of what the heck he's talking about. It's going to have social components and physical components and temporal components and all that. And as we develop this shared understanding, our language will continue to refer to the entities which are only in our head. And the systems that are doing translation now cannot even come close to that minimally. They are totally bad at that, right? So I am not nearly as impressed. I don't think we're getting any understanding. And without understanding, you're not really doing anything that's human, okay? You're doing something else. Again, it's something big. I agree with Dave there. It leads to, you could commoditize it. You can make, money, but it's not the real thing, okay? Actually, I think what's already emerging is something more interesting, which is something which is often called Internet of Things. in the CS world, but that's kind of just the boring problem of putting things on giving IP addresses to everything. It's really this fact that we have flows of data and decisions across the world in commerce, in transportation, in medical care. The whole pandemic response is a ad hoc network of people flying things, data and decisions and occasionally experiments and so on, all around, hoping to damp down, like an immune system would do, a pandemic. Next. Okay, so let me dig in a little bit more to this decision-making side, because the pattern recognition side gets so much attention and people think it's everything. So let's think concretely about, you go into your doctor's office and in 5 years, and your doctor's going to measure all kinds of things about you, your heart rate, your blood pressure and so on, but also your genome, because that's going to be cheap, and a whole bunch of other stuff. So like 100,000 dimensional feature vector will go into a big neural network that has all the world's medical knowledge in it. It's a huge data set and massive computers were used. It becomes the super doctor, right? Is it actually going to be a good doctor, right? And the answer is absolutely not. So for example, one of the output units of that network will be like the heart attack output unit. And if that number is over 0.7, then in the historical data, that suggests you're about ready to have a heart attack instead of have an operation. You sitting in your doctor's office in that moment, are you going to say, yeah, oh my God, the world's smartest thing just told me I'm going to have a heart attack, I better have an operation? No, absolutely not, right? You're going to first of all say, wait a minute, what's your error bar on that? Am I just over 0.7? And moreover, where did the error bar come from? Was this data gathered last week? Was it gathered 10 years ago? What's the provenance of this data? Was it about people like me? Is it about some other people? Was it the same machines that I'm being tested on today? And so on and so forth. We're going to have a whole dialogue. Again, where a neural network is not going to be able to support that dialogue. We're going to have counterfactuals. We're going to say, if we were to try out this other, if I were to eat better, also you're going to remember things about your lifestyle that you never thought of before. That, oh, did you know that I actually had a, back when I was younger, I had a respiratory problem. I forgot all about that. And the whole point is that's not in that neural network. It's not the world's best doctor because it doesn't know everything. It can't, because all kinds of things occur to people as they interact with the world around them and they think through the consequences of various things. All right, so I could go on about this, but the provenance, the relevance, the counterfactual, the dialogue, that's what real intelligence and learning and decision-making are about. And none of that is present in our current massive compute world, all right? All right, secondly, it's never about just one decision. I'm making multiple decisions today, and there are different scales and different scope. What do I eat? What do I talk about? How do I interact with my children and so on? And then it's gonna happen over days and over weeks. Right? It's moreover sets of decision that have interlocking decision makers. All of us are interlocking in our decision making, and there's going to be scarcity. We can't all have the same thing, and we're going to have to fight for it and compete. Next. All right, so let's just really be very concrete about this. Let's take pattern recognition and see how far it goes. So classical recommendation systems are a pattern recognition system, and you know all what they are. If you go to Amazon, you buy a few books, they cluster you with other people who bought similar books, and they recommend some other books that those people bought. So it's massive data in a brute force way. They become a commodity. They're on the prediction side of ML. If you use them for movies and books, you can make billions of dollars, and that's what has happened. What if you use them for other real world things where there's scarcity? Next slide. All right, so suppose I start using this commodity, this wonderful pattern recognition box, to recommend things like restaurants to people. Now, if only a few people are using the app, then no problem. They'll be very happy to get sent to nice restaurants. But what if everybody in Shanghai is using the app, right? Then by chance alone, that app, it's a pattern recognition system. It'll just pattern recognize and send, 10,000 people to the same restaurant, all right? And that's Poisson statistics. It'll happen day after day. That kind of problem will arise. Or if you recommend streets to drivers because they're the fastest streets to the airport, if everyone starts using the app, then you're going to create congestion. Right? If you recommend stock purchases and everyone is using your app, you're going to destabilize the market, and so on and so forth. It's all the interactions among decisions. And here's the point. This is not pattern recognition anymore, right? I don't know which street I want to go down because I don't know how much of a hurry I'm really in until you make me think about it. And if you run an auction, I'm going to have to think about it. But before you ran the auction, I didn't have to think about it. All right. Which restaurant do I want to go to? All right, here's where Silicon Valley and the big data, Googles and all that get it wrong, Facebook especially. They think you're going to understand how to load balance. That, 10,000 people I'm sending to the same restaurant, that's the problem. What I'm going to do is decide these 50 here go to that restaurant, these 50 go to some other restaurant. How do I decide? Well, I know enough about these people because I have all their browsing history. I have all this huge amount of data. I can know them and I can decide which ones they should go to. And I hope you realize how ridiculous this is, but that's actually where the big data, data science people have gone. They think they can figure it out, and they can't, right? Partly because I don't even know in that moment. I think, okay, I see that restaurant looks really interesting. I'd try that out, Thai food, I never had that before, and so on and so forth. So really the way to think about this is we're all involved in markets all the time. We're involved in scarcity, and that has to interact with the data analysis. Next slide. So the alternative to just thinking about massive data kind of in supercompute changing our world is that no, that's not right, because we have to always make decisions in the context of complex other people's decisions and scarcity and over long stretches of time. And the only mechanisms I know to do that has nothing to do with data analysis per se, it's markets. They've been working for thousands of years. They adjust themselves over time, and they're not perfect. Right? And they're going to be made better, and new phenomena will arise, and new thinking will be needed as we put microeconomics together with statistical data analysis, because that's what microeconomics people have never done. They've had all the numbers, the preferences, the game table known, and then you work out the consequences. What if those are not known and people have to experiment, like in a bandit situation? Next slide. All right, so markets are really algorithms. And this is not a very computer sciencey kind of thing to say. Computer scientists were deductive logic, and they put it in the computer, and then they brought in data and made it a little bit inductive. But markets are a whole other thing, and we really need to have them in here. And of course, we have to work more on this. We're going to need 100 years of work on this, because markets are not perfect. They have to be regulated in many ways, and that's the old style markets. These new markets that are emerging are going to have all kinds of new phenomena. Next slide. I'm going to give you a very concrete example. Music. There's more music being listened to today than ever before in history by factors of tens to hundreds. More people making it than ever before. That's amazing, all right? So you think there's this flourishing market, and there's no market, all right? And data science is needed here. So what do I mean by this? Well, if you actually look at data, it turns out that 95% of the songs being listened to today in the US were made by people you never heard of, and were made in the last 2 years. So it's not that the huge, Beyoncé's or whatever, that everyone's listening to them. No, kids walking around with the headphones on are listening to the latest, coolest thing, right? Well, the people who made that are probably other 16-year-olds who on their laptop are really good at making music and put it on SoundCloud. Then the computer science community steals their bits, takes the economic value out of it, and streams the bits to other people, and then restores economic value by advertising against it. They created a fake market on the side of the real market they should have created, which is linking producer and consumer and making economic value flow between the person who wrote the song and the person that listened to the song. Next slide. All right, so how do you fix this? You don't have to go into super intelligence of any kind. You don't have to do anything particularly novel. You just have to do core data science. You think about data science not as doing translation and mimicking humans. You think about it as creating a new kind of market. And to start with, it's really easy. You take each person who's a musician who makes enough music that they're being listened to by people. At the end of the week, they get to see a dashboard, which is a map of the country they live in. And there's a dot every time someone has listened to one of their songs, right? And they now discover that, in Dayton, Ohio, 10,000 people listened to my songs last week. For whatever reason, I don't know why, but I'm popular there. This is just data science, no understanding. But now I can show that to the venue owner in Dayton. They can see the same data I'm looking at, and they can say, yeah, you're popular here. Let's invite you. You give a show, you make $20,000. You do that 3 times during the year, you have a salary. Okay, you're not going to be Beyonce and super money, but you have a salary. You can scale this to 1 billion people in a given country, right? Then they're also connected to their fans. There's producer-consumer relationships. They can say, I'll come play your wedding for $10,000. You'll say 5,000, I'll say 8,000. We created a market. Great things can start to happen because data now is associated with economic value. It's not just data is data, and it's bits on a computer. And by the way, a friend of mine, Steve Stout, has a company called United Masters, which is doing exactly this. He's got 500,000 young musicians signed to this, and the music that you'll hear on AT&T and on the NBA right now is his musicians. So this is actually happening. I've been working with Steve for 5 years on this. Next slide. All right, so the consequences of this is that AI is, or whatever you want to call it, I don't like that term, but it's data science using massive amounts of data can be a job creator, right? Because you got to create new markets, and it doesn't have to be just music. It could be like, I'm building a new house right now. I'd like some art in my house, and I'd like people to bid on my house, and it could be just anybody. It's not just a famous artist who bids on it. And if we created a connection there. So are any companies doing this other than, say, Steve Stout? Well, in some ways, like Uber is more like this. Facebook, no. Google, no. And I think those companies are not innovating anymore because they're not creating new markets. And Amazon, yes, they bring packages to people's doors, so they created a new market. And I think they're still innovating. And I think you can really put companies on the left or right. Are they creating a new market? Then they're actually also doing technological innovation. If they're not creating a new market like Google or Facebook, they're kind of not innovating anymore. And I don't see Google and Facebook actually as innovating. Next slide. Okay, so if you're an academic, are you really intrigued by working on this kind of thing? And yeah, you should be, because there's tons of new problems, all of them conceptual ones at the interface of machine learning or statistical, data and econ. Multi-way markets in which individuals have to explore to learn their preferences, like bandits meet markets. Large-scale multi-way markets. If I'm trying to decide between 100,000 restaurants in Shanghai, there's no way I could explore all of them. I can't have preferences about them. I have to do some kind of a recommendation system to get other people's preferences to inform mine so we can start to play the game. All right, never been studied in econ, totally appropriate for the real world. All right, incentive-aware classification evaluation, auctions in which preferences are learned. And then there's a lot of discussion of privacy and fairness and social good. Well, these are econ-related concepts. You can't talk about that unless you talk about people's utility, and people have different utilities. And so how do we find principles for building this kind of fair system where learning is mixed with the game theory and the mechanism design? Next slide. Next. Okay, really 2 minutes just to give you a flavor for if there are any academics here. I kind of tuned this for CEOs, but just to let you say, here's a project with 2 of my students where we bring together bandits and matching markets. Learning on the one side, econ on the other. Next slide. All right, here's my favorite learning problem. There's several options. There's only 3, but there could be 10,000. I don't know which one is my favorite one, so I pull one of the arms. Next slide. Just now start paging for a while. Next, next, next. So you get a reward, you pull another arm, you get a reward, keep going, keep going. All right, and you start to learn about these arms and you get a confidence interval. And there's an algorithm which says pick the highest confidence bound, the upper confidence bound item. Next slide, just keep paging for a while. You pick that arm, all right, and that has the uncertainty as well as the trying to optimize your reward built into it. And keep going, please just keep paging. So stop there for a second. So that's on the learning side, and there's beautiful theory about it. It's a real thing. Out in industry, you do A/B tests, and they're built on this kind of technology. On the econ side, there's been Nobel Prize for this, but it's really important too. In the real world, matching markets. On the one side, buyers, on the other side, sellers. You have preferences known a priori. That's what we're not going to have anymore. But if you know the preferences, there's algorithms like Gale-Shapley which match things. Next. All right. So what if we put these 2 together? What if we have, next slide, on the one side, multiple agents, and they're competing with each other. They're both trying to learn about which is the best arm. All right, next slide. But from time to time, they'll both pick the same arm. And we have an econ model there of scarcity. Both of them can't get that arm, sorry. So what's gonna happen? Next slide. The arm has preferences back on the other side, the left side of the market. And so it's gonna say, I prefer the bear, I'm gonna give the bear the reward and the human gets no reward. And now you ask, how do the humans behave in this situation? And there's new algorithms needed. And next slide. We developed such a market, a bandit market algorithm. Next slide. Next slide. Let me just skip this. I wanted to say you can do, there's mathematics here. You can do new notions of regret. Next slide. And you can have an algorithm. It's Gale-Shapley meets upper confidence bounds. And you can tell agents how to behave in very, very large scale markets. So the overall system actually learns and people get what they want. Next slide. Here's the piece of mathematics that says, how do you do that? And here's a penalty. It's a statistical bound, but it has an econ penalty in the denominator. Next slide. Okay, so my last little section here, take about, most 5 more minutes, is that I want to now pop up a little bit to the next level, back to kind of the real world, not just academics, and think about how to build the future, if you agree with my perspective here. Well, first of all, it's very much industry academic partnerships. All right, so the real problems I think are mostly in industry. And if you go out there, they had the word data science long before academics did. And also you need new distributed software platforms because there's no way you can build an engineering discipline without them. And these arise in academia. That's actually the open source movement has made that happen. No one buys software from companies anymore. And then startups are the critical bridging role between these 2 things. Next slide. So I'm just going to mention a project with a bunch of colleagues at Berkeley where we've built a platform called Ray, which is being used at Amazon. It's being used at banks. It's being used at Alibaba in China in production. We did it as academics. And it basically is an econ data science platform that allows you to run on massive computers, the kind of things Dave was talking about, econ related data science problems. We created a company called AnyScale that does this. And you know, the previous company that my colleague Jan Stojka did called Databricks is now valued, I think, at 13.2 billion. It didn't do any econ stuff. So we think we have a clear business model here. Next slide. I'm going to go ahead and, should I finish in 1 minute? I want to leave time for, Ado, just tell me, okay?
Yes, you have like, let's say 4 or 6 more minutes. So
okay, let me try to do 4 on the lower side of that. So Ray is, the current machine learning ecosystems. This is behind what David was talking about. You have training, you have serving, you have streaming, you have reinforcement learning. The algorithms were developed on a single computer. Next slide. And then people said, oh, how do we make this be a distributed system so we can do it at this massive scale? And separate software stacks were developed for each of those capabilities. Often these were done in academics, but Google did some of them as well. Next slide. Ray says, no, let's get rid of all that. Let's build one distributed system, which is underlying, and then everything else is libraries on top of that. Next slide. And conceptually, this is actually a really, really simple notion. Python is a big success because it has functional programming and it has object-oriented programming. The big wave of activity at Google to build MapReduce and so on was all functional programming. MapReduce is functional programming. They got rid of objects because that didn't scale. Next slide. But if we're going to do things like dialogues and have massive neural nets as part of our ecosystem, but not only embedded in bigger ones, you have to have objects and functions. So Ray does exactly that. Next slide. And so 3 years of work, now there's several hundred people contributing to this, has led to an underlying infrastructure that does all the handling of objects and actors with scheduling and management and so on and so forth. Next slide. This is an example of taking a piece of software. It's a piece of Python code that someone wrote at DeepMind and trying to do hyperparameter search. And it was working fine at small scale, and they wanted to run it on tens of thousands of computers to do AlphaGo kind of things. They said, how do we do this really easily? We don't have the time to build it. Next slide. So they just added a few red lines there that made it a Ray-ready program. It could run now in Ray, which allowed it to immediately scale to any scale of computers. So you just added like 4 lines, and that was it. So next slide. Here is an example. You may have heard of Ant Group that almost had an IPO. Well, inside of Ant Group is this is Ray. And so here's an example. These programs take in on a cell phone. They featureize it. They put that in a big training, and then they serve the model back to the cell phone. As of a couple of years ago, this was happening once a day. And they spent a huge amount of engineering effort to get it down to 1 hour after like a year of work. And that increased their revenue hugely. Next slide. They then implemented it using Ray. They brought Ray in and they contributed to the open source development. Chinese people did, amazingly. Anyway, it came down from an hour to 5 minutes using Ray with no change to the software. And that was also a massive economic boom. Next slide. It's open source. Next slide, there's the GitHub. You can go there yourself right now and start contributing to it. The growth is now matching Spark. It's geometric growth. So Spark is the #1 platform worldwide, by the way. So we think we'll match that. We are matching that. Next slide. Contributors slide. Next slide. And then some of you might be, oh, sorry, that's the library on top of it right now. I want to get one more slide. Next slide. And so here's some of the companies that are actually using this in production. So the main point I wanted to make here was not so much bragging about what we did, but rather that surprisingly industrial problems at scale are being solved by academic software. And if you haven't kind of been following that, I hope that you're awakened to this. So Goldman Sachs is using this, Microsoft, Ant Financial, Amazon, and so on and so forth. And I think the next slide is my final slide. Okay, so that's a slide I already had up there before, but I hope to prevent a misunderstanding. AI is not happening. I totally agree with Rod Brooks. The real deep understanding involving like understanding language and all that, not even close. But what we're missing and why the revolution hasn't really happened yet is not just that. That's what I was writing about in that article. But really, it's because we're not thinking about markets. We're not thinking about the planetary scale systems that involve humans and their preferences and actions and scarcity. So the only way to get us all to be happy and have value is to put all this stuff we've been talking together with microeconomics. Thank you.
Thank you very much, Michael. Very interesting perspective, lots of new information. We are on the last leg of this session. So I'd like to turn it over to Michael Kohler with just a brief recap. So we heard from David, compute and data supremacy. We heard from Don, a role for understanding the world through experimentation and the role of big ideas. I think Michael also agrees with the role for big ideas and, presented his own characterization of the future focused on understanding, decision, and coordination among the decisions, and, for example, through markets. And I think everyone agrees on this session that there's nothing to AI. So that was surprising and interesting. And actually, I do agree with that point. And I want to poke one more hole into a current way that AI is portrayed. And I think I'd like to hear Michael's perspective on that. So AI has been portrayed as deep learning largely, right? And so first of all, when I think of deep learning, it's just another technique like linear models or, mixture models and so on and so forth that has been chosen and has been supported by a huge amount of resources. And second, deep learning has serious limitations themselves. And so I'm just a user of deep learning, if any. Michael has actually done some in-depth technical analysis of deep learning models, in particular over-parameterized deep learning models. And I would like to hear from you, Michael, your opinion about deep learning models or parameterized deep learning models, in particular, when what kind of conditions they need to really perform at the level that's been portrayed in the media, in terms of, say, amount of data that's needed or signal to noise ratio. Do these models ever break down, Michael?
Okay, let me start. I'm not sure whether I will actually answer your question. Let me first start by saying that I should make my. I really liked both talks, and I'm one who is working on the mathematical foundation of deep learning since several years already, and I have first to confess, I think we are at the beginning with this. So I think we have some results for the pattern recognition, but nothing on the decision making. So the decision making will be maybe in the future, but let me talk more about the pattern recognition. Instead of pattern recognition, you usually make it in regression. So you study these kind of estimates as regression estimates, and then you look what can you say about them. And there are several aspects on this. The first one thing, regression, that's a function estimation problem. So if you estimate a function with a special class of, say, neural networks, you have some kind of approximation problems. And there's a lot of understanding in the recent years about the approximation with deep neural networks, because we learned about that we can approximate with these networks rather perfect or rather good piecewise polynomials, or basically splines, multiplied splines with 3 knots, and that's great. And then the second point is, because of the network structure, it's easy to approximate also. If you can approximate some kind of function, you can approximate compositions of functions. And that leads to great results about dimension reduction in high-dimensional regression problems. And there are, as I told you already, there are several aspects on the deep learning. One is the approximation. The second one is the generalization, because you learn this function from some noisy data. This is nowadays also well understood. If you use if you use underparameterized neural networks, then you can just use the classical Wapnick-Jovanenko theory. That's well understood. But the big open problem is the optimization. So somehow you define your estimate by minimizing some empirical risk, and then you have to solve this minimization problem. And that's where the overparameterization comes into play, because there was a recent line of research tried to show, okay, who actually showed if you use overparameterized neural networks, then it's easy to solve the optimization problem, because you will find even with gradient descent network which interpolates your training data more or less. But I have strong doubts whether that's successful in terms of generalization. Okay, I think that's my comments.
Thank you very much, Michael. The papers by Michael and the paper by Belkin et al. On PNAS that Michael has referenced are actually on the content page of our library. So I think I did receive quite an amount of questions, which was expected, but we're like 4 minutes to the end of this panel. So I think I'd like to thank Dave and Don and Mike and Michael very much for their contribution and for making time today. Thank you very much. It's been great having you here.
Good afternoon, and thank you very much to our session 2 participants. That was a very spirited discussion and very impassioned. So thank you very much. We all learned a bunch. We now come to our 3rd session this afternoon, and it's I think something that'll be very, very important to our practitioner community here, and it's a review of statistical and machine learning ideas and methodologies that promise to impact the practice of systematic investing. And we're really fortunate today to have an outstanding roster of professors that have a particular focus in this discipline. Starting out, we have Emmanuel Condas, and Emmanuel comes to us today from Stanford University, where he is a professor of mathematics and statistics and the Barnum-Simons Chair. We thank you for being today. Also with us is Jun Liu. Jun comes to us from Harvard University, where he's a professor of statistics. And also with us today is Panos Toulis. Panos comes to us from the University of Chicago Booth School of Business, where he is an assistant professor of statistics. I appreciate all of you joining us today. Very excited for this panel. And Ed, I'll turn it over to you. Thank you.
Thank you, John. I would also like to thank our distinguished presenters here on behalf of the Statistical Science Department at Temple University. Thank you for being here, everyone. So like John mentioned, this session is going to be focused on ideas and tools for systematic investing. And we have roughly, a third of our participants from the industry sector and a 2/3 from the academic community. So for people who may not be familiar with systematic investing, the signal to noise ratio in this situation is typically very low, even lower than in computational advertising and AdWord type auctions. So methods to tighten the error bars are typically of interest, and especially new ideas that are somewhat model free, because it's always easy to tighten the error bar assuming a model, but that's typically a fatal mistake in a lot of applications. This is the topic of today's panel. Variable selection independent of interactions, multiple testing, methods that could navigate bias, variance trade-offs, penalize estimations. So we'll explore some new ideas in this space. So in our content library, we have a list of papers by the speakers and also related papers. Recently, Emmanuel Condas put forward the idea of knockoffs. And you can read about knockoff filters on the page that's linked. And in June, even more recently, has been further innovating by introducing a techniques based of data on data splitting that is leveraging some of these ideas. So I'm going to turn it over to June. June, go ahead. Thank you for being here today.
Thank you very much. Thank you, John, and thank you, Edo, for the nice introduction. It's a great pleasure to be in this panel. So this work is some of our recent progresses. It's completely inspired and also stimulated by the work of Emmanuel Condas, who I guess has moved on somewhat, but a lot of his followers are still working on this related problems. It's very interesting, and also another aspect that motivated us was exactly as Edo mentioned. We try to be more model-free in some sense, but it's always their price to pay. Anyway, okay, so I will, next slide, please. This is collaboration with a few of my students, and I will introduce the FDR control stuff, assuming many of you may not be familiar with the topic. And then I will mostly focus on data splitting ideas. It's actually pretty straightforward in terms of the approach. It just split the data and then do things to create independent confirmations of each other. Okay, next slide. So one of the fundamental concepts of this FDR control was introduced by this landmark paper by Benjamin Hochberg, who are thinking about scenarios where you have many independent hypothesis testing tasks to do. It's just one setting. There are actually many related settings in bioinformatics, in finance, and so on. Basically, you can regard all, there are many different evidences, different so-called signal-like observations, but you want to really discern which one is true signal, which one are noise. So you can formulate them as a p-value problem or the hypothesis testing to test whether the means are non-zero or zero. So the one of the most celebrated or simplified version is the normal means problem. You have a sequence of independent normal observations and with potentially different means and different from zeros, and you want to figure out which one is not zero. So typically you can use p-values and the next slides. And their procedure is to, next slide, please, is to actually order the p-values and then draw a line, which is controlled by the so-called FDR rate. Suppose you want to control the error rate at 10%, 0.1. Then after you order these p-values, you just draw this red line, which is touching the other side at 0.1. And then whatever hypothesis p-values under this line will be selected. And you can prove that the false positives below this line, for your selection is somewhat controlled at the level. So this can be proved by when this independent, but when they are correlated, there are some price you have to pay. And if they're not too correlated, this is almost correct. So, but if they're too correlated, there could be trouble. There's some relaxations. Next slides. Next slides. Oops. Yeah. So here we are thinking about the situations where there could be correlations. That is, we are thinking about regression scenarios. This could be high dimensional or moderate dimensional. The P is usually very large. So I saw in some finance data why this P could be a few thousands, and number of observations could be hundreds of thousands. And in some biology data, it's a little reversed. The P could be tens or hundreds of thousands, and the N could be a few thousands. So there are situations both ways, and they're both real, and actually very, very, very much real. Very many people are interested in getting something out of this type of data. So we're interested in doing model selections in some sense, and one approach is to do simple regression or some kind of a penalized regression and trying to decide whether you have selected the right predictors or not. So the notation-wise, we think about say S0s are those coefficients corresponding to zeros. Those features coefficients are having been zeros. And S1s are those non-zero coefficients that our goal is to figure out which one belongs to S1, but we try to include as fewer from S0 as possible. And the so-called FDR control is to control that in your selection, the percentage of the variables you selected from S0 is bounded by a rate Q, or in probability, or in some asymptotic sense. We all will talk about. And we mostly will cover the linear models and some graphical models, and also some generalized linear models, and trying to see this data splitting approach, how it works. Next slide. For FDR control in the regression model, there's some early works based on this Benjamini Hodgkopf procedures. Although these p-values are correlated, if they are not too highly correlated, their original procedure works pretty well. So especially in dimension when p is relatively small compared to n. But when p is becoming comparable to n, then the problem may occur when they're somewhat correlated. And there are some different extensions, but the extensions typically are different ways of coping with correlations, but they tend to be very conservative based on this modified BH procedure. There also early work on data splitting, which is to use the first half to do to find variables, and then you use second half to set up a p-values, and then you use that to do variable selection. That's still reasonable. So this approach is useful for high dimensions. But as you can see, once you do data splitting, you sort of weaken your signal in this case. So that's somewhat one price you have to pay. We hope later on I will try to see if you use multiple data splitting approach to aggregate all this splits information, you actually can get back the almost full information. The recent revolution was, as we all mentioned, by Immanuel Candi's group, and they have developed a very innovative ways of doing this variable selection. I think, to me, there are sort of two key ideas from this approach. The general idea is to create fake variables, and the consequence of creating these fake variables, there are two. One is so-called self-referencing, meaning that you don't really need the p-value to tell you whether it's good or not or bad. You can do so-called self-referencing. For if it's a null variables, this particular variables, because of the knockoff, should show some kind of a symmetry around zero behavior. And another one is somewhat make this kind of information independent. Next slide. So this is a brief introduction of these knockoffs in 2014 paper. They have many different variations afterwards, so I have no way to cover all of them. But interested people, please check their websites. They're very interesting progresses. And here is just say you can think about these pictures. The left is the real variables, the right is the fake ones. You create exact copy, not exact copy, sort of a fake copy with the exact size of the original X. And one way to make them is to make this particular covariance matrix design. And in this way, you can guarantee the so-called exchangeability things. There are a few approaches. One is more efficient than others, and over the years, people have had some nice progresses along this direction. But this is rough idea. And in low-dimensional case, you could do this exactly without assuming anything about X. But in high dimensions, you may need to assume some joint distribution of the X's, or at least up to some nice exponential families. You have to make some assumptions in that way. The next slide. So this is the fundamental of self-referencing. That is, if it's a null variable, you create this statistics based on either knockoff or we do data splitting, so that under the null hypothesis, this is symmetrically distributed around zero. So this is marginally symmetric. So that's one thing. And also, so we mostly utilize this. Another one, as I mentioned, is somewhat the sign independence. That one we cannot achieve anymore because of the correlations. So another effect we would like this to have is the so-called signal strengthening. This is hard to achieve, but at least don't do too much signal weakening when it has a signal. So this is related to the optimal way of constructing this this particular statistics. Next slide. So the data splitting approach goes as follows. You just split the data into equal half, and then you can estimate sort of two coefficients, and we generally call the impact measurements. Really means if you are actually doing the neural networks, you can still measure these things, but it's no longer coefficients. It's really the influence functions. And then you can construct this mirror statistics by, I think this is pretty general. I don't know whether this is the most general forms, which is the sign of these two coefficients and multiplied a function of the absolute value of the magnitude of these two coefficients. There are some typical approaches, the most straightforward is this -1, but this turns out to be less efficient. There are more, I think this one was first observed to be relatively more efficient in the original Candice paper. And recently, some of my colleagues, Tracy Cook, they have done some work to prove this is optimal under certain case. You can also think this is somewhat optimal from hypothesis testing. If you use Neyman Pearson lemma, you sort of can argue this is the best. If you think about this, this data splitting create these two copies of the beta estimates. And if you look at two-dimensional, they're just spherical Gaussian asymptotically. So if you do sort of hypothesis testing, optimal boundary will be just like this one. So it's not hard, but I will not give you details. The next slide. So once you have this kind of symmetry and you require something, so heuristically, you just need to use the negative tails to account for the false positives. So imagine you are cutting off at the boundary, which is tau, which is the statistics is tau. And those true signals tend to be large, positive. So that's on the red part. And the blue parts correspond to the false positives. You of course don't know which one is belonging to the blue part, but you can use the negative tail to estimate this amount. So that's the idea of knockoff, and this also the self-referencing, and the same here. Another thing we sort of need to assume that this individually is fine, marginally is correct, but if you want to accumulate them, like sum of all these quantities, you need somewhat weak correlation assumptions, which typically can be satisfied in high-dimensional linear models. And if you want to prove some asymptotic properties, those standard assumptions usually can imply this type of weak correlations. But even when they are highly correlated, as we tested, they still work, but we can't prove it anymore. Next slide. The multiple data splitting is also, as name suggested, you do this multiple times, and then each time you will have a collection of variables being selected, and then you try to assemble them together to get the coherent ones. The next slide. The next. So the way we assemble them is slightly different from what people have done for data splitting. And this one we introduce the so-called inclusion rate. That is, for each data split exercise, some were being selected, some were not. So suppose we only selected 100 out of 1,000 variables, and then each selected variables will give a weight of 1/100. That is 1 over the number of selected variables, and all the others will be 0. So for each selection, the total inclusion rate is exactly 1. So then for those variables, they tend to be selected more. So if you accumulate their selection rate, take average, they tend to be large. So you can order them according to this inclusion rate, and then you can cut off at the smallest ones at a certain level so that they sum up to Q. We can actually prove under some asymptotic property that this is pretty conservative. And if the single data splitting can keep this control, this FDR control, then this multiple data splitting will also be able to do that. And actually it's slightly better than the single ones, but how much better we cannot really quantify. So next slide. So this is illustration of this multiple data splitting effect. So this is very simple normal mean problem. So in this case, actually, the p-value is the perfect summary of the statistic. That's what we call as the full information. You can imagine you do the data split, you split in half, and you do this kind of mean estimate contrast. If you do one data split, it's very noisy, right? Because some by chance will be large, some by chance will be small. So if you look at this scattered yellow dots, these are sort of one data split. They sort of, this score are all over the place. They're very non-concentrated. But if you replicate this many times, you can see this is the p-value. They're almost monotone functional p-values. So that's nearly perfect recovering the full information. And these just illustrating the blue dots are those resulting from like 10,000 replicates. And this orange dots are 400. 400 is pretty good. In practice, we also compare the powers. Next slide. Next slide. So you can see that even with about like 400, 100, well, I don't have that slide, but usually with 100 to 200 data splitting, you can almost get saturated. You can't really get much more. So this is also power comparison for the normal mean problem compared to the this BH procedure, which is supposed to be the optimal in that case. And you can see this is almost indistinguishable. The blue one and also the gray one. So these are almost indistinguishable. The red one is the single data split. You can see clearly the power loss. The next slides. So for linear models, especially in both high dimensions, if it's very low dimensions, you can just do two independent OLS, the ordinary least square, then you do the contrast, that's fine. But if you have high dimensions, we usually suggest to do the lasso, but with relatively more loose lambda, but we want to be able to do to have so-called screening property, meaning you include all the relevant variables. And then you can use those selected variables from the first half of data and to do the ordinary least square on the second half. Then you can construct this MJ for all the variables. And in this case, you can prove they are symmetric properties satisfied and so on. Another strategy is to use post-selection inference. You can also do that. We tried both. It seems to be not too much difference. The first one seems to be easier. The next slides. So we did some comparisons for different sizes of covariance matrix and compare with BH procedure and also the knockoff. As you can see, this is, I don't know how clear you can see. The top figures are FDR control. The nominal level is 0.1, so they seems to be all doing very well. And this block ones are some procedures from this Swiss group, and they tend to be very conservative. This one way of doing this kind of multiple data splitting things. You can see especially the weak signal case and also high correlation case, this multiple data splitting are doing well. So, but in relatively independent case and the strong signal case, the knockoff seems to be doing better. So that seems to be consistently observed in many different settings. Next slide. And this is a case where the assumption seems to be violated for almost all methods. This is reasonably high dimensions, but there's a constant correlation, meaning that all of them have equal correlation. That's the case. You can't, the correlation is really not weak. Eigenvalues were getting large. You can see this is the independent case. The knockoff is doing quite well. The MDS is not too bad. This is FDR control level. So the lower right corner will be better. So this one, the X direction is the power, the Y direction is FDR control. FDR levels, you want that to be low. And you can see in this case where the correlation become large, 0.1. So MDS is getting lower FDR and also higher power in this case. The next slide. We also try some non-normal designs. This was the example has been tried in some of the knockoff literatures, which we used some correlation, the axis from this GWAS studies. These typically correspond to the SNPs, so they are not continuous, they're actually discrete values. So it's not particularly normal, but they're not too bad if you have large enough, they're almost. So MDS is doing well in many cases, especially you can see the weak signal case. This is relatively weak signal case is doing quite well. So that's one thing we observe. We still don't understand why exactly and this multiple data splitting works seems to be able to recover this subtle signals in the weak signal case. Next slides. This is some non-Gaussian designs. The covariance matrix are the axes are simulated from T distribution or mixture Gaussian distributions, and this is a little unfair for other methods because when you assume they're normal, then this is misspecification. They tend to have errors. But this is just trying to show that multiple data splitting seems to be quite robust to this type of different design matrices. So you can see the MDS for this blue triangles, their FDR almost always under the control. Next slides. I don't know how much time do I have. Next, yeah, this is graphical model. I won't
give about 5 minutes.
Yeah. Next slides. Yeah, this is just result. Next slides. So this is about interest. I just want to mention this generalized linear model case. It's also inspired by, also stimulated by Candice's work. And as you can see, both of this works actually were communicated very clearly and very excitingly by his very fabulous students. One is this Pragya Sir, and another is Lucas. Lucas Jensen. I mean, so both of them were hired recent years, and then during their talks and their casual conversations, so we got quite stimulated, and especially my students were very excited to learn these things. And this is also a recent work. They found that in the moderate dimensional case where P and N are of the same order, so that's the P over N is converging to some constant between 0 and 0.5. And then the asymptotic results for the MLE in the nonlinear, in this generalized linear model is no longer the classic one. There's somewhat a rescaling effect. In other words, the center will be rescaled compared to the truth, and the standard deviation will also be rescaled. So this creates quite some issues and problems in the classic inference. If you want to give a confidence interval, even asymptotically correct the confidence interval is not very easy to get because of this very tricky normalizing factor, alpha star and sigma star here. But we can actually using data splitting to do this without worrying about alpha star and beta, sigma star. Of course, we will not be able to give a confidence interval, but we can actually do this variable selections quite well, because under the null, beta j star is 0, that's the true beta. Then the only unknown factor is sigma star. But sigma star, if you only use the symmetry property, not the scale property, then it's okay. So we actually are completely fine without knowing that if you're just creating a mirror statistics. So that's how it works. So the next slide. So if we use the data splitting, it works quite well. So this is the large P and N. And also this ABHQ is the adjusted procedure using p-values. That's actually adjustment based on this Candice and the Sir's results to adjust the correct scales, then it works the best. So BHQ has FDR out of control, so this gray squares should not be counted. But the best one, which is still under the control, is this ABHSQ. But you can see MDS is actually not far. It's very closely matching the results in this particular case. And also the next slides. In the case, like in some other models, negative binomial, I don't think so far we have known these rescaling factors. So there's no nice papers. Maybe Emmanuel already had a new paper on that, but that will be a different formula. But in this case, the MDS is still doing quite well without having to know that. The last, okay, next slide. So in the high dimensions, of course, we can do this so-called debiasing lasso. But somehow this debiasing lasso achieve asymptotic normality rather slow, but it achieved the symmetry rather quicker. The next slides. So this is the picture. So you can see if you use the normal p-value, it's pretty bad. That's the right top angle. But if you just use the symmetry to create this contrast statistic, they're quite symmetry around 0. You can see the right lower figure. So because of this, if you use the data splitting to do contrast, it's actually doing quite well. The next slide. The MDS shows very good power compared to other methods. The knockoff somehow in these cases are not doing very well, but I don't know exact reasons. Anyway, so I probably, the next slides. Yeah, we tried a real data example, which has been analyzed also by Candice group. This is microarrays and trying to figure out which genes are particularly responsive in this different types of treatments and so on. So the next slides, I just don't have time to give you much details, but here is just the genes we selected, and the top half were also selected by knockoff. So we selected a set which is the superset of the set selected by knockoff. So basically double the size. And the right columns are some literature supports for the findings. There seems to be some support for our findings in this case. It's not completely sure yet, but it's somewhat sign support. Okay, so the next slides will be, well, I think it's an interesting work. I don't want to read through that, and it's stimulated by the great statisticians like Bin and also Emmanuel's group. And next slide, I'd like to acknowledge, so Lucas has been quite instrumental in stimulating us to think about this. And also Bin's talk on this data perturbation has been quite also stimulating. Let's give us some basic ideas. So there are quite a few collaborators on this work, and they're all young and energetic. Thank you very much. I will stop here.
Thank you, Jun. Very interesting work. It seems like multiple data splitting is both reasonable and powerful, especially as the independence assumption fails and as you move to moderate to stronger correlations of the signal. So something to try out for sure. I'm gonna now turn it over to Emmanuel Candes, who, as you have heard, has worked and has pioneered actually the knockoff filters and is still been working on knockoff filters. But today he's gonna talk to us about something new, model-free, robust machine learning predictions, or conformal predictions, as he calls it. So I'm gonna turn it over to you. Thank you very much, Emmanuel, for being here.
Thank you very much. I'd like to thank the organizers, and especially John Leone and you, Edo, for inviting us. I enjoyed the talk by Jun Yu very much. I think it's fantastic work and it's extremely important. I've learned a lot from Jun when I was a student. Jun was a professor at Stanford when I was a beginning graduate student, and I've learned a lot. I'm still learning a lot from Jun. I'm teaching a Markov chain class where I use this fantastic book to stimulate students. So it's a pleasure to be in a panel with Jun.
Thank you very much.
Today, I'll talk about reliable and recent progress in predictive inference. Next slide. And, this was machine learning 15 years ago. The goal was to predict movie ratings. And I think in hindsight, we can say this, which is whether we got these predictions right or wrong, it did not matter. Next slide.
But fast forward to today, we're using machine learning tools in extremely sensitive applications. For instance, for facial recognitions and drivers, and you've heard the problems associated with this. Next slide. I'm not sure if you know about this, but probably you do. People use machine learning tools to assist judges in US courts to make decisions. For example, there are companies who sell products, essentially criminal risk assessment scores, to help judges make decisions about who should get paroled, who should get bailed. And it's very hard for me to think about a more critical application of machine learning, a more sensitive application of machine learning, as it directly impacts our lives. And so, next slide, please. Of course, AI has a lot of promise. We are being sold that AI will improve medicine, will improve healthcare. You know, and people use deep learning for medical diagnostics. And I think in automated healthcare, you know, I think we should learn when we need to pass control to a human doctors when the diagnostic of a network, the confidence of the diagnostic of a network is low. But how do we know that a deep learning architecture, which is very opaque, is well calibrated? How do we know that its confidence is low? And so I think it becomes extremely important as we deploy machine learning to work on more and more sensitive applications that impact our lives directly, to be able to assess uncertainty a bit better and to understand when is it that a deep learning or a gradient boosted machine has low confidence in its prediction. And so as a toy example, we can imagine that we are a university like Stanford or Harvard, and they want to recruit students, and they gather a lot of features about each applicant, and they're going to try to perhaps offload some of the decision to a machine learning system that would predict how well this candidate will do at Stanford. And perhaps a deep learning architecture will spit out a score of 3.62. But then how confidence do I have in this prediction? And the way I would like to think about this in this lecture is through predictive intervals. So this is very easy to follow lecture, I think. The way we're going to think about this is we need reliable systems. We need to understand that when the cost of a wrong decision may be extremely high. And so traditionally in statistics, we like to produce confidence intervals. So here we're not going to talk about confidence intervals about parameters. We're going to talk about predictive intervals, about future observations. And so what I would like to see more often in the way data scientists and AI researchers communicate the outcome of their research is in the form of these predictive intervals. So I would like to have a prescription, which is that it's not enough to give me a point estimate. You have to give me a range. And I want this range C of X, that is a predicted range of labels. For example, in the case of my student, it would be the predicted range of a GPA after 2 years at Harvard, let's say. And I would like this range to be accurate 90% of the time. That's a prescription. And I think we all agree that as the consequences of our decision impact people's lives, this is extremely important. Now, why do we not see this more often? Next slide. I think we don't see this more often because we are way past simple regressions for which we have learned simple formulas to actually construct these predictive intervals. We use methods that are quite opaque and are very powerful, but it's not easy interpretable. And there is a whole lot of research that I will not talk about in this lecture that shows that somehow that this method can be really badly calibrated. But I think one of the reasons we do not see predictive intervals is that we use very fancy algorithms that by all means we should almost treat as black boxes. Next slide. Yet we'll see something a bit bizarre in this talk, which is that it is possible to construct predictive intervals that are valid no matter what the distribution of the data is, no matter what black box you're using. And this is work that was done with Yaniv Romano and Evan Patterson last year. Next slide. Now, this is something concrete. You'll see a method that is concrete. And I was pleased to see that actually it was picked up by the Washington Post by the fantastic work of John Cherian and Lenny Bronner. Lenny Bronner is a data scientist at the Post. John Cherian is a a Stanford student working for the Washington Post. And they use a method that I'll present to actually project results on election night. I'll say more at the end of the talk about what they've done, but I've been informed, and of course, during the night of the election, I watched the projection from the Post with with my heart beating, and I was informed by the news desk that the model worked very well. Next slide, please. So what are these prediction intervals? So in abstractly, what we have is we have a bunch of training data, as is common in machine learning, and we have a test point. So the features Xi's, in the case of my applicants, might be which high school you went to, what were your high school grades, your ACT scores, your level of physical fitness, extracurricular activities, information about your parents, siblings, whatever. And Y is a sort of a quantitative measure of how you do if Harvard, say, were to admit you in its prestigious university. So what we'll do is the goal is to construct a predictive interval, a set C of xn plus 1 that contains a true label 90% of the time. And we don't want to make any assumption about the distribution of xy. We don't want to make assumption about the sample size. We want this to work always because the stakes are high. So in plain language, we want to say that based on the candidate's high school identifier, GPA, ACT scores, and everything I can have measured about an applicant, I would like to predict that the GPA range will be between 3.4 and 3.8. And I want this prediction to be correct 90 or 95% of the time or whatever. Next slide. Okay, so I just want to start with, suppose you had solved the problem. So what does it mean to have solved the problem? It means that suppose you know the distribution of y given x. Okay, so if you knew the distribution of y given x, you can see that, I don't know if you see, do you see my mouse? Probably not, right? You see it? No. So you can see that at every value of x, you would know the distribution of the response given x. And therefore, you could compute the lower quantile and the higher quantile of this conditional distribution. Next slide. And you could connect them to get, for each value of x, a very valid predicted range because you know the distribution of y given x. So I gave away the problem to you, and you compute the quantiles of the conditional distribution of y given x, and then you connect them. Next slide. But this is too easy. I don't know what is the distribution of x and y. All I have is this. What am I supposed to do? So we're going to do two things. Next slide. We're going to connect two areas of statistics. One is quantile regression, and this is a fantastic paper. So if my talk can be anything, it's just an encouragement for people who listen to me to read this wonderful paper by Roger Conker and Gilbert Bassett from 1978 about quantile regression. Next slide. So, okay, so I see the math did not come out too well, but on the PowerPoint translation, but I hope you can try to see what this is. So we're going to try to formulate the learning problem as a regression problem. And so instead of using your usual squared loss, I'm going to use a loss which is called the spin-ball loss that you see on the right. And on the right, you see something that looks like the absolute value function, except that the slope may not be the same. And this is a loss that function, when you use your neural net or your gradient boosted machine with a loss function like this, will actually try to find the conditional quantiles in your data instead of the mean. So if we use the squared loss, then of course we're fitting the regression function. But if we should fit one of these losses, we're going to try to find the conditional quantiles in your data. So I'm suggesting that when you use this very fancy algorithm that we've talked about before, neural nets, gradient boosted machines, not with the squared loss, but with this loss to actually try to find the quantiles in the data. And so what you could do is we try to do this. This is a quantiles fitted by some method, and then we fit the lower quantile and upper quantile, and we hope that this will approximate the true quantiles. Now, is this valid? Next slide. And it is not valid at all. In fact, for those of you who have experience with neural nets, and we certainly fit a lot of neural nets at Stanford, neural nets might actually go to zero training error, which means that the two quantiles will be the same roughly. And so you can imagine that your out-of-sample performance will be a disaster. In this case, because we were trying to be careful, it's not a disaster. It's about 66% coverage. You want 90, you got 66. Obviously, your quantized estimate are too optimistic. Next slide. So what we're going to do is we're going to take this first impulse and we're going to wrap around it. And we're going to build a wrapper around the, a neural net quantile estimate machine to actually make it calibrated and make it valid. And as we'll see, the method we propose will work no matter the sample size, no matter the dimensionality of the data, no matter the black box you use, no matter the distribution of the data. Next slide. So how's this going to work? So there are many versions of this. I'm going to present the simplest version, and then whomever is interested, Ido was kind enough to collect references, and so there are lots of variations on what you'll see in the references that are in the library. So you give me a data, I'm going to split it in a proper training set and a calibration set. Okay, so the proper training set is on the left, it's in black, the calibration set is on the right. It's a bit like what June was saying, it's a bit of a data splitting step. You don't have to do it, but it's simpler if I present it this way. Next slide. On the first set, you actually run your quantile regression estimate. But now we know that it's not going to work. So we're going to see how well it does on the calibration set. And we're going to score how well this does on the calibration set by scoring each individual point. Next slide. So we're going to score individual points, and a point will receive a positive score or negative score, depending on whether it's within your prediction band or outside of your prediction band. So you're going to have a positive score if you're outside of the prediction band, and a negative score if you're inside the prediction band. All right, next slide. And how these scores are constructed, it's very, very easy. So if you're outside, I'm going to look at the nearest boundary, and that's your score. If you're inside, I'm also looking at the nearest boundary, but I put a negative sign. Okay, so let's say that we have 300 points in the calibration set. Therefore, we have 300 scores, and these are signed distance to the nearest boundary. Extremely simple. So now I have 300 numbers, and what do? I take the 90th percentile of these 300 numbers. So I'm looking at the 270th largest values of these percentiles. And I'm going to return as my prediction band whatever I fitted with my neural nets, but adjusted by this Q. I'm going to subtract and add Q. Now let's understand what this is doing a little bit. So suppose by some miracles, the neural net was actually fitting very good quantiles to start with. Then 10% of the point would be outside, 90% would be inside, and therefore the 90th percentile would be roughly 0, in which case I would not touch the great job that the neural net has done. But suppose the neural net, as is often the case, is too optimistic it's too confident about its predictive power. The thing will be too narrow, and so there would be more than 10% of the points outside. And so therefore, when I look at the quantiles of these scores, it will be positive. And so what that would mean is I would actually enlarge the width of my prediction band. If you're, on the other hand, a bit like June and myself, you're a bit conservative because you were well-trained, maybe you start with quantiles, and that's kind of an interesting point. You start with quantiles that are a bit too conservative. You want 90%, you get 95%, in which case your value Q would actually be negative, and you would actually shrink them. It says, no, Emmanuel, you followed yourself, you're too conservative. You don't need to be that conservative. You would actually shrink your estimate. Next slide. Now, when we use this procedure on the same data set, it's too good to be true. I want 90%, I get 90.09%. So this is quite remarkable. Next slide. Is this an accident? No, it's a theorem. And the theorem is that you can prove that this method, which is very, very simple, as you can see, achieves 90% coverage, almost exactly. That is, it's a theorem that the coverage of your predictive interval is at least 90%. That is, your predictive interval will contain the true response 90% of the time, and no more than 90%. And again, it applies always. Next slide, please. Now, what I'm not saying is that this is building up on the work of Vladimir Vovk, who is a person I admire, is working in England, at Imperial College, I think. And so what we're doing is we're marrying quantile regression with ideals for conformal inference. Next slide, please. I think Vovk got a lot of things right, almost everything right, but maybe not the last part. And so what Vovk was advocating is to fit, and again, the math did not come out right on the translation, but basically you fit a neural net, or you fit a learning rule by minimizing the squared loss, you compute the residuals, and then you build the prediction band by actually looking at the prediction at a new test point, plus or minus the quantiles of the residuals. And the reason I think it's not exactly the right answer is that, as you can see, your prediction interval has constant widths, right? So it has a center, which of course depends on where you are. It depends on your regression function, but the width is constant. And that's not capturing the heteroscedasticity that we have in the data. This is going to be made extremely precise on the next slide, please. On this plot, where we have a very heteroscedastic data set, where essentially the conditional variance of y given x changes as a function of x. And you see on the left, you see the Vovk approach, which is essentially fitting a prediction interval of constant widths with the CQR method that I'm advocating, which you see that somehow the width of your interval depends enormously of where you are in space. As a result, it's a theorem that both methods achieve 90% marginal coverage, which is what you see empirically. But the reason, like what we adaptive, means that the method we have has much shorter length, so that it has more informative intervals. Next slide, please. So the right picture is essentially a length of the interval produced by these two methods as a function of x. And so you can see the blue curve is our method, the CQR method. The red curve is Vovk methods. Vovk method produces intervals with constant widths, where we are highly adaptive as to where in x. Now there is something which is very interesting here, which is also check the conditional coverage as a function of x. And the blue curve, which we see on the left, achieves almost a lot of conditional coverage, no matter what the value of x is. But the Vovk method doesn't. And sometimes it undercovers, sometimes it overcovers. And you can see that in finance application, if we can go back one or two slides. Go back one slide. Yeah. One more slide. Yeah. So if we go back one more slide, I think one of the problem is, suppose that the data is heteroscedastic and you actually build confidence prediction interval based on the size of the residuals, the quantiles of the residual. Suppose you're in finance, because I think that's one of the themes of the conference. Suppose you're in finance and you have periods where you have high volatility, period where you have low volatility. I think what the Vovk method will do is will tend to undercover in the high volatility because the response is more spread, and it will overcover in the periods where the volatility is low. So as a function of volatility, you'd either undercover or overcover, while the method we propose should be far more adaptive to the level of volatility, because it's what you fit when you fit your quantile regression. So let's go back 2 slides. Go up 2 slides. Forward 2 slides. Yeah. One more slide. Yeah, so we actually did a lot of data analysis. We used these methods, which are implemented, which I'll give you links to website where you can actually download Python and R packages to actually predict utilization of medical services. This is one of the data set we looked at. We have lots of covariates, age, marital status, race, poverty status, and so on. And the goal is to predict healthcare system utilization, for example, as measured by the number of visits to a doctor's office or hospital, and so on. It's a high-dimensional data set with 140 features and 16,000 subjects. Next slide. We use one of this extremely sophisticated method of neural net regression with a pinball loss. We use this CQR method, And so it's a theorem that both Wolf's method and our method achieves marginal coverage. This is what you see on the left. In terms of conditional coverage, we do better, and in terms of lengths, we do better. So we produce intervals that are more adaptive, they're shorter, they have better conditional coverage, and they have exact marginal coverage. Next slide. So this is if you're interested in healthcare, but we looked at Facebook data, we looked at a lot of data from science, and you can look at the paper. And so what we found is that this method was helpful, would outperform traditional methods in 10 out of 11 regression data sets that we actually have looked at. All right. There is an extension, next slide please, to discrete labels. And how much time do I have left, Edo?
About 5 minutes.
Okay, so I have 5 minutes. So maybe this is instead of discussing these extensions to discrete labels, maybe I can just tell the audience that, you know, of course, there are lots of problems where the response variable is categorical. You know, what kind of objects do I have in front of a car if I'm interested in a self-driving car? And you would like to be able to also return short predictive sets in classification problems. And we have extensions of the method that you've seen to deal with categorical variables. In the interest of time, I will skip this slide and the next. So next slide, next slide, next slide. This works well. And I will just wrap up to go back to election night. So next slide, please. Yes. So again, I want to emphasize that this is not really my work. This is the work of John Chirian and Lenny Bronner. I think I mentioned before that John Chirian is a student at Stanford and Lenny Bronner is a data scientist working at the Washington Post. Next slide. So these are the kind of information you could see displayed on the Washington Post website. And so, you know, the Washington Post, and this is the Washington Post, November 4th at 11:50 at night. And so this was the state of Pennsylvania, which, as you know, was a very contended state. And so the Washington Post was issuing predictions based on the model. Next slide, please. And so what you can see from the next slide is very early on, the Washington Post was able to predict, if you look at the left panel, that Biden would eventually win Pennsylvania. And so they had a very good way of actually displaying prediction intervals by using a very delicate color schemes. And they also were able to break the predictions in terms of the kind of county that you were. And so, so this is the kind of information that the Washington Post displayed running the method you've seen. Next slide. This is a few days later, November 7th at 8:30 a.m. Of course, the prediction became tighter because we had more data. Next slide. And, you know, now quite a bit of confidence that Biden would be ahead when the count is finished. And so, as I said before, the model worked quite well. So next slide, please. So, okay. So I had prepared some slides, but they were translated, and so somehow we don't see them very well. But basically, the way, just to give you a sense of what was on this slide. So the way the Washington Post looked at this thing was that counties are going to start reporting, right? And so for each county, we have a bunch of county features, you know, demographic features, whether it's an urban or not urban, and so on. And so the Washington Post was interested in predicting 3 types of outcome. One is the voter turnout in 2020. And to do this, they defined a regression variable, which was the voter turnout in 2020 minus the voter turnout in 2016. And then they were interested in the number of Republican or Democratic votes, which we're going to write RI20 or DI20. So this is the number of Republican votes in county number I in 2020. And of course, the number of Democratic votes in the county number I in 2020. And as a regression variable, they used the fraction, the difference in the rate for which you vote for Republicans and Democrats between 2020 and 2016. And now counties start to report. So you see variables. So you see the data from a few counties, and you have missing counties, and you're going to use the method you've seen to actually predict to actually build up confidence prediction interval for the counties that have not yet reported. Now, there's one thing that should make you worry. Next slide, please. It is, are counties being reported? Are we drawing counties out of an urn? And no, we are not, because the counties actually do not appear in random order. You know that maybe some counties with some characteristic report earlier than others. So the data is not exactly exchangeable. And that's where the thing breaks up a bit. But, you know, I'm not going to go over through the details of what was done as opposed to actually deal with this issue. Because you had access to previous elections, you could see by playing the movie of the counties in the order in which counties show up, you could adjust the confidence level to make sure that all through the night and the ensuing days, you maintain coverage. So the only assumption we make here in this talk is that the data are shown to you in a sort of a random order. It's not exactly the case, but the Washington Post came up with a very clever way to adjust the inference to deal with the ordering based on previous elections. Next slide. So if you're interested in this, there's a website and code. I think June said it nicely. It's important to be transparent and reproducible. And so people can download and reproduce what we've done. Next slide. And I think my time is up. So I showed you a method to basically get reliable predictive intervals. I think it's extremely important as we deploy machine learning in very sensitive applications. The election is one of these sensitive applications. It's important to get it right. I listed quite a few references. If people are interested in the theory and the work of Vladimir Vov, there's his book, Algorithmic Learning in a Random World, that I recommend everybody take a look. It has changed a bit my life. And so with this, I'll pass it on to you, Edo.
Thank you very much, Emmanuel. Very cool method. Again, one more innovative, very cool method. Like June, I'm a big fan of your work, as you know, and for everyone, Emmanuel is very understated and very modest, but he only combined a couple of ideas that existed out there, but clearly, he knew which two ideas to combine and exactly how to combine them to fix the issues and apply them to a very important problem. So, well done. Thank you for sharing your work with us. And Vov reference is listed, by the way, on our content library. So please, with the link. So please take a look. Thank you again. And I'm going to turn it over to Panos. Panos is a former student at Harvard, and now he's a professor at the University School of Business in Chicago. Happens to be one of my outstanding students. So Panos, welcome, and thank you for being here. I'm going to turn it over to you. I think you're going to tell us about a couple of new things that you've been working on to control errors.
Okay. Yes. Hi. Thanks for the kind invitation. I'm really happy to be here. I'm also humbled to be in the presence of such distinguished speakers. So Edo, be prepared to be disappointed. So today I'm talking about a new method, a new approach to doing inference. It relies on the randomization framework first developed by, it does originate in Fisher's work, but it was formalized by Lehman and Romano. Next slide, please. My setting is pretty simple. It's the standard regression model. We have y with the responses, x's are the covariates, beta are the model parameters, and epsilons are going to be our errors. This little omicron that you see over there, that's kind of an error in translation. This will be epsilon. So the betas are going to be our object of inference. We'd like to do inference here, but our key departure from the classical frameworks, the classical approaches, is that we're not putting any assumptions yet. And part of the proposal in this work is that we just don't rush into making these assumptions, so that we try to make inference to develop a mode of inference that is as flexible as possible. Next slide, please. So just a review of those standard approaches. Of course, there's the parametric approach. We just have a model for these epsilons. We derive some estimators, let's say ULS. We do some mathematical statistics, CLT, and then we say we kind of use this asymptotics to do inference. Or we can do bootstrap, which is a non-parametric approach. We can either, and there are two variants of that. We can either resample this in the entire rows of our data. That's the pairs bootstrap. Or, and less well-known, but actually better in practice, is to bootstrap flavor is when you fix the x's, your covariates, and then you resample the residuals. And that was pioneered by the pivotal work by Friedman and Lane. However, both approaches require some form of extensibility. In many cases, in most analysis, you have assumptions about IIDness, some assumptions about the x's, and both of them cannot handle easily complex error structure. And this is at the core of this proposal today, is to try to address the more errors that are, or like problems, data that have a more interesting, more complex structure than just plain IID or plain extensibility even. So both methods rely on approximations. They do rely on asymptotics, and in most cases, they do rely on well-behaved estimators. So the proposal I'm going to discuss today can work even under ill-behaved estimators, even inconsistent estimators, for that matter. Next slide, please. So am I saying that something is wrong with Bootstrap? No, nothing. There's nothing per se, right? This is the most important, one of the most important statistical tools. However, the main critique that I'm developing here is that it was introduced as, since inception, it was based on uniform sampling. So when you try to accommodate, to address complex error structures, you need extensive modifications. So that's why we have so many flavors of Bootstrap. We have residual, wild, cluster, block, stationary, pigeonhole, multiplier, Poisson. It's just a whole zoo of different Bootstrap flavors. So, and I think and that's my philosophical take, let's say, is that the Bootstrap starts with a procedure, right? It starts with this resampling. It starts with what you have to do with your data, and then goes ahead to accommodate your particular problem structure. And my argument is that it should be the other way around. First, we have to think about what the structure of the problem is, and then think about what procedure to use. In some sense, Bootstrap has always been this heavy hammer in search of nails, right? And sometimes we have to duct tape a screwdriver around it. So next slide, please. So what I mean by when I say complex error structures, well, in practice, we do have complex dependencies, okay? So, and we do require, and most methods require some form of invariance assumptions on these errors, even implicitly. In most cases, these assumptions are implicit. Some form. What do I mean by invariance? Well, when we assume that the errors are ID normal, that's already an invariance assumption that we are making. But that's not as primitive as assuming, let's say, that the data are extensible, like the errors are extensible, which can happen when the errors are being generated under identical conditions, for instance. The errors might not be extensible, but that might be sign symmetric, or they might be clustered. Suppose, for instance, you get observations from different firms. And there might be clustered, your data might be clustered by firm, or the data might be clustered by the geography. You might have a time dependence, that's an autocorrelation structure. Or they might have double clustering or triple clustering. Suppose you have panel data where these are clustered by the firm, by time, by geography, etc. So there's all sorts of invariances, all sorts of structures that can appear. And unfortunately, right now, we need a new method, a different method for each one of these different structures. So my promise here, or at least the promise of this approach, will be that it's to develop a unified way to address all these heterogeneous settings. Next slide, please. So what is the proposal here? What are we going to do? First of all, it will be just a different way of thinking. Like, first of all, we'll try to think about what invariance assumptions are matching with our problem structure. So before we even begin thinking about the procedure, first we have to define what is the error invariance that we're going to base our inference on. For that matter, we're going to assume that there's a group of transformations G, where your errors, if you apply these transformations on your errors are distributionally equivalent. It doesn't invariant. The distribution doesn't change for any transformation from that group. For instance, extensibility, something that Emmanuel mentioned before, is basically you kind of shuffle your data, you shuffle your errors, and the distribution doesn't change. And these are assumptions. This is a more primitive assumption than assuming IID. It's like a weaker assumption, right? Or when you're assuming normality, you're assuming extensibility, but your IID normality, you're assuming extensibility, but you're also assuming sign symmetry and other sorts of more primitive invariances in your data. So in this case, in going back to that extensibility, in this case, this capital G, script G in the original slides, is basically the symmetric group. And the algebraic structure, the fact that this is an algebraic group is important for the validity of the methods going forward. Now, this G can be anything, right? You can have some weird structure. It can be, you can have like time dependencies, you can have cluster dependencies, double cluster dependencies, etc. So in this case, naive bootstrapping cannot longer work, right? You cannot go ahead and just start permuting data and expecting that this is going to work. And that's not a failure of the bootstrap. It's just is more like, I think, a failure of our understanding that it's really the problem structure that matters, and it's not a question of what procedure to use. Going forward, this G, I would call it inferential primitive, because this will be the important object that will basically inform the inference. Going forward, the idea will be that the analyst is going to define what is the inferential primitive for the particular problem, and then more or less the procedure will be defined after that. It will be determined after that decision. So this is the promise of unifying all these different settings under like a common inferential framework. So next slide, please. So the general idea is as follows, and this will be an infeasible, an idealized procedure, but I will make it concrete in the next slide. So suppose we have again this regression model. We're not making an assumption about the errors. I'm not assuming that they're normal. I'm not assuming they're IID, but I'm assuming that they do satisfy that that invariance. Okay, in that with G being the inferential primitive. And suppose we have some hypothesis to test on the betas. Later it will be a linear hypothesis, but let's keep it general for now. There are two key components to the idea here. One is to have a test statistic such that under the null hypothesis, your test statistic is a known function of the errors of your regression. So that's the first thing. And this is not so such a strict of a requirement. In most of my implementations, this test statistic is basically the OLS. It's based on OLS. So you can, based on classical OLS theory, you can show that this condition can be satisfied easily. Now, suppose now that you can take that function, this T of n, and you can just take these errors and apply those transformations at random. Let's call this capital T, and then in the second component, the second part of that method, just calculate the p-value using that capital T with respect to whatever you observed in data, the observed value of your test statistic. Now, standard normalization theory by Lehmann and Romano suggests that this p-value is exact for testing the null. And the proof is very straightforward. You can show that whatever the randomization statistic you have over there, this capital T, has the same distribution as your test statistic, just which follows from the invariance property that we have already assumed. The group property of this G is also important, and that's part of this. Just to keep things simple. And I should say that at this point, that randomization theory is maybe a misnomer. It doesn't have a good PR. When we say randomization theory, randomization test, this does not require an actual randomized experiment. At the heart of that theory is really the invariances, the group invariances, and not the actual act of randomization. But it kind of comes from Fisher. It was developed according to that language. So it's called randomization theory right now. And actually, conformal inference is an extension of the, or is part of the randomization framework as well. Okay, so next slide, please. So here's a concrete example. As I said, this is an infeasible method. It's using the actual errors, but these are unobserved. So what can we do in practice? Well, suppose we want to test a very kind of simple significance test on the jth component of your unknown parameter. Suppose we want to test that beta j is equal to 0. What do? Well, first of all, assume that beta j is equal to 0, solve the restricted OLS, and get your restricted residuals. So the idea will be basically just plug in those restricted residuals in the procedure that I mentioned before. Your test statistic, how to satisfy that condition on the test statistic? Well, just take the regular OLS. Standard theory will tell you that under the null hypothesis, this is a known function of your errors, and that Pn function, you can see it over there. It's a classical projection on the standard projection on the column space of x's. So that condition satisfied, great. And then we just plug in those restricted residuals and we calculate the p-value out of that. And so our decision for the null hypothesis for the significance test is basically depends on that p-value. It's as simple as that. Okay, it just relies on simple OLS and restricted OLS calculations, and this you have to make that assumption of the error invariances. Just a quick note about the theory. Next slide, please. Just to kind of show you what is the promise in terms of the theory. What do we what is this method is doing better? Like why do I think that this method is going to be more robust than other approaches? Well, the main condition for the validity of this test, by validity I mean that just controlling the level of the test under the null, is that this condition in equation 1. So if this condition in equation 1 holds, then the test is asymptotically valid. Now this condition has 3 weird terms, but I can give you the intuitions behind them. I can show you why I believe this type of approach will be more robust and hopefully will kind of open up new ways to do inference. So this term 2 is actually is a term that quantifies the richness, if you will, of this set of invariances. The inference will break. The proposal that my proposal here will break. For instance, if these transformations you're making are not rich enough. Let's say that instead of permuting n elements, you just permuting only 2 of them as n increases. Of course, you don't have too many permutations involved, so it's not this set is not rich enough. This richness is not a formal term, but it just kind of shows you that the type of transformations you're making, that complexity, it does affect the validity, like the extent of your inference. This term 3 over there that you can see is basically, you can think of it as your transformations preserving the information structure. This inverse, you probably recognize the Fisher information there in that expression, term 3. So intuitively, kind of all these things together, they kind of tell you that your estimator, which is term 1, your richness of this transformation you're making, your referential primitive, and how this relates to the information structure of your problem. All of this have to interact in a synergize so that you get that asymptotic validity. I think the important another important point here is that this term 1 doesn't have to go to 0. So basically, this method can work even with inconsistent estimators, even with ill-behaved estimators. So for instance, suppose that your errors, the variance of your errors increase with n. It can happen, right? Like the more data points you collect, perhaps the more noise is being introduced. In this case, the OLS is not squared n consistent. It might be not even n consistent, right? So it doesn't matter. Well, the important thing here is it doesn't matter that you have a consistent estimator. What matters is that synergy between all those elements, your estimator and your inferential primitive. Okay. Next slide, please. And the next one for the rest of this presentation will be mostly examples, kind of illustrate to you the logic behind this and what I think is kind of new and novel and useful about it. Suppose we have clustered errors. Suppose we have a very simple regression model like the one that I had over there. In this display, the axes are just simple, just from 0 to 1, and the errors are clustered. So there are 2 clusters. One cluster, the variance is very small. When x is your covariance is like less than 0.9, and above that threshold, the variance is much larger. So in this case, of course, the data are not exchangeable, like your errors are not exchangeable. They are exchangeable within clusters, though, and that's the key structure that we can utilize. But if you do just run naive OLS, then you will see that we just fail to detect significance. And not only that, this interval is tilted to the wrong direction. Now, but in this case, the structure is obvious, right? We can have exchangeability within clusters. So if we had that knowledge, then we can just apply that method, this residual randomization method, where instead of just doing this resampling of the residuals uniformly. We only do this resampling within the particular clusters. Okay, so next slide, please. So if you do that, if you just define your Z, your inferential primitive, as permutations within those clusters, then you can test your significance. You can have your you can implement your significance test. And not only that, you can run a test for any value of your slope. As you can see, that you can for different values of that beta in this null hypothesis, we can generate a p-value. And this is the so-called p-value plot, where you can cut it horizontally at like 0.025 or like 0.5, depending on what is your targeted significance, and then whatever remains, what's below that plot, will be your confidence interval. This is called test inversion, and it can give you. We can use that method to invert it to get confidence intervals as well. So in this case, the confidence intervals that comes from this more using this type of resampling that's more adapted to the problem structure gives us a confidence interval that's 0.03, 0.025. It's not exactly centered at the true value, which here is 0.2, but it is close, and it's definitely better than the regular OLS, of course. Okay, and the reason, of course, is it should be no surprise. We're just utilizing the structure that is inherent in this problem. Next slide, please. Here's another structure that might be more useful for financial applications. Suppose you have autocorrelated errors. Suppose that the errors in this case might have an AR structure, but might even be non-stationary. So what can you do? Well, there are several robust error methods for that. There are hack methods, heteroscedasticity, autocorrelation, consistent methods in the literature. There's also the block and stationary bootstrap methods that are available. However, all of them, both of them are not robust to strong dependence, like to kind of strong autocorrelations. They don't work very well in small samples, and also very, very sensitive to your covariates as well. If your covariates have notoriously, if they have heavy tails, then these methods are not going to perform that well. So what can we do here? What type of invariance can we exploit here in that type of problem? Well, there is one. If we stare a little bit into that autocorrelation structure, just one type of invariance comes forward. Next slide, please. So with that simple model, then what we can say is that if we condition on some epsilon being 0, then what comes next is going to be sign symmetric. Okay, and that follows immediately from this AR structure, essentially. Okay, so the idea here will be that, well, let's define an entirely new inferential primitive where we're going to look into a residual plot like that. And instead of just resampling like what naive bootstrap is doing, we're going to do this reflection around the time axis. And why can we do that? Is because we are assuming that the structure of the errors have this particular AR form. Okay, and so the idea here is basically to say, essentially to say that this G, this inferential primitive, are basically just reflections around the time axis, and then this type of transformations in our residuals will give us. Basically, we just plug it in our procedure, and will give us in our inference. And by the way, this type of trick, this type of procedure, can be applied even with errors that are non-stationary, which we don't have good methods right now for that even. Next slide, please. Here's just one example of how this method works. I have the errors to have a simple autocorrelation structure. I look into errors that have like normal innovations, even like a mixture innovations. I look into cases where we have covariates that are IID, that are autocorrelated, and also that they have thin tails, or they have heavy tails. And there's just too much happening here. I cannot point your attention. I don't have the pointer. So let me just say that the reflection test, this residual randomization method, it is robust across all these different domains. And it is because, first of all, we're conditioning on the x's, so the heavy tails of this covariance is not a problem. And second of all, we're just using that AR structure correctly, right? We're just adapting to the problem structure. Whereas if you look at OLS, of course, it's going to break because it doesn't work under those under the settings. But also the hack errors are quite sensitive to whatever errors distribution of the errors you have, and also whenever you have thin-tailed covariates or you have heavy-tailed covariates, you can see that it diverges a lot beyond this point of 0.05, which is the nominal coverage. Okay, so just one final example. Next slide, please. Just a cherry on top. Suppose we're seeing that in an entirely new application. Suppose we have data with I is going to be firm, time is basically a time, and we do have just a very simple kind of a panel, like a panel data model. And we do have x's that have an autocorrelation structure, and they also have log normal errors, which are heavy-tailed. Suppose we have errors they do have this autocorrelation structure, but they also have random firm effects, and they also have normal errors. So what are we going to do now? It's a very complex model. There's a very complex structure. What method are we going to apply? Are we going to use Bootstrap? Are we going to use block Bootstrap, hack errors? Are we going to do Fama Macbeth errors? Well, just try to adapt to the invariances in your problem. Next slide, please. Actually, what you can do here is, if you one observation is that if you demean over time your errors, now these have the autocorrelation structure that I presented earlier. So just use the reflection invariance this gref that I presented in the previous slide. So that's one. Okay, so in our resampling, what we could do, we could just take the residuals, average over time, subtract for the actual residuals, and then do this reflection test. That's one idea. If the innovations in the random firm effects are extensible, then we can actually also exchange the rows of this residual matrix. Okay, so both of these can work, assuming that under the assumptions, of course, of correct invariance. Here's simple simulated study: 5 firms, 200 data points, strong autocorrelation, and suppose these firm effects are T with 5 degrees of freedom. OLS breaks, of course. If you do a simple hack version where you just average over firms and then you do hack robust errors, it is better, but still very much over rejecting. The correct level here is 5%. And if you look into the residual normalization method based on these invariances that I presented earlier, you can actually get to, these are all of them valid, and the one flavor that's what I call conditional is actually very close to the nominal level as well. I don't have time to describe the difference between a conditional and conditional, but I do have that in the paper if you're interested. And the code for this particular example, you can download it, you can play with it, just load it and just run the main simulation. You'll see how this exactly works in practice. Okay, so next slide, and that concludes for me. I talked about residual randomization, which the main promise here is that it is going to address inference in regression models with complex error structure, be it one clustering, double clustering, autocorrelation structures. If you look into the idea is that you look into what invariance, what problems, what kind of structure might make sense in your problem, and then you kind of take that and then you plug it into this residual normalization procedure. And in that sense, it addresses inference with these complex error structures in a unified way. Okay, so instead of starting with the procedure and then thinking about the structure, we start with the structure and then thinking about the procedure, which I think it's a better approach. If you look into the paper, there are like extensive comparisons to several flavors of Bootstrap, several flavors of robust error methods. So what I think is a notable feature of this approach is that the same exact procedure is being applied to widely different settings with clustering, double clustering, autocorrelation, etc., and even high dimensional regression as well. For each one of these settings, there's a different method out there. So we have to develop a different method. Where here, in contrast, this type of approach gives you the same procedure for all those different settings. So hopefully you can see some value in it, can try it out, and perhaps it opens up like a new mode of inference that's more flexible. Next slide, and that's it. So if you're interested, there's some more information. I have a working paper. There's an R package called RRI. There's a technical report that kind of walks you through that package, and there's a link there for if you're interested more in that. And I should repeat as well that example with the this panel data structure, you can find in that link on that slide. So thanks for your attention. I hope it didn't go over time, but thanks again.
Thank you, Panos. Can confirm we did not disappoint. Very good job. So I'm very excited about all these new ideas, cutting edge ideas, very simple, multiple data splitting, conformal quantitative regression, and residual randomization, or maybe residual invariant resampling procedures. They're very simple. As you've seen, they're very powerful. And all the references to papers, to code, and to other resources will be posted in the content library page of the event. So let me conclude by thanking our distinguished speakers again on behalf of the Statistical Science Department and the Fox School of Business at Temple University. Thank you very much for being here. We really appreciate your work. Thank you. I'm going to turn it over to you, John.
Thank you. The primary objective of Wells Fargo and our partners at Temple is to build a collaborative community between practitioners and academics. And when I think back to David Donahoe and what he said today, building on his comments, we stand at the confluence of the classical, the math first, the theoretical, the academic. And now it's intersecting with the upstart, the data first, the empirical, the industrial. And this academic industrial confluence is exemplified in quantitative investing. The seeds for quantitative investing are sown in academia. And it's our privilege to unite these communities. It really is. And on behalf of me and my Wells Fargo teammates, I want to thank our distinguished speakers. Boy, you all just allowed us to view so many things in a different lens today, and you did a fantastic job. Thank you so much. I want to thank our partners at Temple, in particular, Dean Ron Anderson for all of your support, and most notably Edo Arialdi, who did yeoman's work in putting this together. So again, per Edo, please continue to visit the website. The publications from all of our participating faculty are listed there. In addition to that, the content was so good we didn't have time for question and answers. There is a website, there's an email address on the website. If you have questions, please continue to send them. We will forward them on to our faculty members here, because so many the catalysts for new research usually is born in practice. So by all means, please send your questions to us. And last, I'd say, hopefully the world's back to normal this time next year, and we hope to see you all on the Temple campus. Edo's got a really nice spot picked out for us, and Wells Fargo is delighted to be partnering with them, and we will see you all in Philly next year. Thank you so much.